Hi, good morning, everyone. My name is Theodora. I'll be today's moderator for the online part of the conference. I'd like to welcome you to our fourth annual conference. While we're waiting to let everyone to join us, I'd like to let you know that today's conference is going to be recorded and later on uploaded to Aġenzija Sapport's YouTube channel and to the website. So if you cannot join us for the entire day, the recording will be available to be watched later. Your microphones have been muted, and I kindly ask you to stay muted throughout the conference. If you do have any questions or comments that you would like to share with the speakers, you're more than welcome to unmute yourself and share your thoughts or your questions. However, if you don't feel comfortable doing so, you can also send the questions via the comments bar below, and I can read out the questions for you. There is also a time allocated for question and answers with all our speakers towards the end of their speeches. We have a very good and interesting lineup of speakers, including both international and local speakers as well. I think we can start off. We have a video message from Malta's Minister for Inclusion and Social Wellbeing, Giulia Farrugia Portelli, which will be played shortly.
Dear colleagues, both local and international stakeholders, professionals and participants, thank you for joining us for the third annual conference coordinated by the Access to Communication and Technology Unit within Aġenzija Sapport, Malta's National Agency for Persons with Disability. Assistive technology remains one of the areas on top of our agenda, both on agency and also on government level. We are committed to investing in the development and sustainability of this area, as assistive technology is indeed one of the key ingredients that are required for full inclusion of persons with disability. This also facilitates equity and accessibility in the most important aspects of one's life. Here I refer to full accessibility and inclusion at the workplace, in education, and also one's social life. In turn, this enables persons with disability to access their rights and live with dignity, autonomy, independence, and overall quality of life. This is indeed only achievable thanks to the constant collaboration between stakeholders, a good number of which are represented and also attending this conference today. We boast about our expertise in this area. The strong team of therapists and professionals within our main specialized service, the Access to Communication and Technology Unit, has a myriad of expertise and knowledge, and whom we can rely for constant developments and service provision for our service users, most particularly their valuable early intervention work with children with communication difficulties and other disabilities. The timing of this conference comes just as we mark the World Children's Day, with this year's theme being For Every Child, Every Right. So we do this to ensure that the rights of children with disability are also protected. We give them a voice and we give them the necessary tools for them to live independently. Nonetheless, we are also committed to constant sharing of best practices to continue strengthening this area and address any needs. The Memorandum of Understanding between IS Bologna and Aġenzija Sapport, committing to sharing of expertise and host study visits between Malta and Italy. The current collaboration between Aġenzija Sapport and the ICT faculty within the University of Malta for the development of a novel web browser for people with severe motor impairments. Our current efforts to implement our electoral promise to invest in training on artificial intelligence and assistive technology while providing more technological resources for persons with disability. These are only a few examples reflecting the importance and value we give to this sector and its constant development, which goes beyond basic service provision. It is very encouraging also to have the participation of renowned local and international key stakeholders, which will surely enhance the value and output of this conference, share best practices, and solidly discuss not only the current scenario in this aspect, impact, but also present recommendations for where we need to go. I welcome you all and thank you. Dear
Okay, a big thank you to our Minister for that warm welcome. Now we will be hearing from the CEO of Aġenzija Sapport, Mr. Oliver Shiklina.
Good morning, Theodora. Good morning, everyone. Currently, I'm the CEO of Aġenzija Sapport, under which responsibility we have the ACTU, which does a lot of work vis-a-vis in assessing and making sure that persons out there, especially children and young people who have communication difficulties, are reached through our assessments and then provided with a very, very detailed reporting so that each individual will be able to have communication aids of some sort. As my colleagues know, during the past months and years, we had our own challenges as an agency and as ACTU, but I believe that I should commend the work that is being done through our therapists to be able to cater for the people who require our services. Currently, I believe that Malta as a state should be working towards having a strategy when it comes to implementing the way forward when it comes to accessible communication aids, because as a state we are not yet understanding and realizing where we are heading. If we look back at the history of the unit itself, when it was working at education, then it was transferred at Aġenzija Sapport. We have seen more people wanting to be assessed, especially parents of children with communication difficulties, and that is an answer in itself that more awareness has been done, obviously through NGOs who are providing funds to purchase these devices, these equipment. But we need to make sure that as a country we are well prepared for the coming future, so that our team is not just have the adequate human resources, but is given the right importance as a team. We are fortunate enough to have a team which is full of experience and full of expertise in this sector, and that is a proud thing as an agency that we boast about. Now we are going to have also some new people, new therapists who are going to join in, not as employees of the agency, but as therapists who are going to help us provide this service. But that is not enough, in my opinion, as I believe that Aġenzija Sapport should continue to give importance to strengthen the ACTU to be able to properly function as we want it to function. I congratulate the ACTU team to be able to, because they really worked hard, not just in doing their own job every day, but also in creating this online conference. And I believe that in the coming future, maybe next year or the year in the years to come, we should think at creating a conference which would be face-to-face, and not just on an online conference. I know that today that there is going to be a hybrid sort of thing, so it's an improvement over the previous conferences. I wish you all a pleasant stay here online, and hope you enjoy the conference for today. Thank you, and good day.
Thank you, Oliver, for that welcome. So a gentle reminder that this conference is being recorded and will be available on Aġenzija Sapport's website and YouTube channel at a later date. I would like to ask you to remain muted for the conference unless you have any questions or comments that you would like to share with the speakers. I can see that people are sending their names in the chat box. I would like to ask you if you could stop doing that, please. We will be sending certificates to anyone who sends us an email. My colleague is going to be sending the ACTU email in the chat box. And you have until the 29th of November to request a certificate, please, till noon. If you can send us also your address, so your work address or your home address, please, as we will be sending the certificates by post this year. Thank you. I would like to let you know that there is the option for captioning that you can put on through Zoom. So if you press the 3 dots where it says more and you read through the settings, there will be the word captions, and you can choose to put them on and show them. We also would like to ask you if you can fill in our evaluation form. It's going to be open until the 6th of December till noon, and we will also be sending it in the chat box. It would be great if you can fill it in for us, as we like to grow from the feedback that we receive each year from the conference. My screen. So I would like to let you know that this conference is being organized as part of an Erasmus Plus project, which is co-funded by the European Union. The Erasmus project is aimed to create a European forum for inclusion practitioners. And this project is aimed to provide a forum to be able to connect and share materials, information, and case studies to inspire action for inclusion around Europe and even internationally. We really do encourage you to sign up to the IFIP group. You can see the website on the slide on the screen at the moment. And you can subscribe to the European Forum. You can also use the QR code that is on the screen to sign up. So I'm going to leave that there for a little bit. Today's conference is going to be all about digital assistive technology and the current situation and way forward. And we are going to be joined by some local and international speakers. Our keynote speaker is Mr. Ebertian, who is an international advocate for access to assistive technology and digital inclusion. He works for several organizations, among which AIS Bologna, where he leads the assistive technology team, and the We Care Center for Research and Innovation. So I'm going to be passing the floor to Mr. Ebertian now. Thank you.
Good morning, everybody. I'm going to share my screen. I've prepared a couple of slides, too many actually, but I will leave them with you. So if we don't manage to remain within the 45 minutes, so please cut me off, and the rest you'll have the opportunity then to consult through Theodore and the colleagues in ACTU. Again, good morning. It's a big honor for me to be here with you today. There's an established collaboration between the organization that I work for, which is called AIS Bologna, and the ACTU service. So that's all very positive. Also on Monday, there will be more people from ACTU coming to visit us here in Bologna and to work together on the challenges that we have identified as needed for solutions. Something about myself, I'm not a very Italian name. That's because I'm originally from the Netherlands, but I live and work in Italy since 1990. My background is in communication, and basically being head of that assistive technology team, I consider myself mainly a service provider, although we do research as well. I'm further active at international level. It was already been mentioned by Theodora. I'm the past president of the Association for the Advancement of Assistive Technology in Europe, and currently their Secretary General. We work at global level as well through GATO, which is a global alliance of 80 organizations. And that's maybe also nice to know. I'm active in, together with my colleagues in AAS, active in the European Association of Service Providers for Persons with Disabilities. But also that's an organization very well known to you because last year there was the ESPD conference in Malta, hosted by yourselves. My idea was to talk a little bit about the importance of digital assistive technology for people with disabilities, what are relevant policy frameworks and policy priorities. I was encouraged by the introduction of the ministry and also of the CEO of ACTU. Apparently there is a sort of a need to further develop, to reflect on how we can further strengthen the capacity of the country to respond to the needs of people with disabilities in this domain. So I would also like to say something about the paradigm shift from AT to digital inclusion. And if there's time left, maybe we can discuss a little bit also how technology can support the delivery of care and remote care and support services, but that's just an option depending on the time. I very often start with this slide, basically because I like the picture, but it's more than that. It reflects how actually we're assisting to a different way to perceive technology. Most of you are probably aware of the biopsychosocial model of human functioning. Some researchers started to add technology to that. The models say that there are different factors that determine human function, so biological, psychological, social factors. But technology is an increasingly central element in determining lives of people and in providing access to opportunities in different dimensions of life. It has always been assistive technology, and all kinds of technologies have fulfilled that role. But increasingly, these technologies are so central and so close to our bodies as well. In some cases, they're even implemented in our bodies, that basically we can say that if we want to optimize human functioning, technology has to be acknowledged as the main enabling factor. It also means that we need to look very holistically at people's needs and the barriers that they encounter, but also if you want to reflect on strategies and way of empowerment, again, technology is something that we cannot do without anymore. It's just part of it. What the consequences of this are for example, the development of support services is a very interesting question. Yesterday, in preparing this, I was just thinking about basically, I mean, like we go to the dentist maybe twice a year. Maybe people should have an opportunity, people with disabilities, with functional problems or limitations. The WHO calls it functional problems. Basically, there should be a place where you can go and twice a year, for example, look again into how technology can better support you. Well, okay, so I don't know how much you know about assistive technology. I presume there are people in the audience that are very knowledgeable about it and others maybe a little bit less. So it's a very broad term actually that refers to all technology-based solutions, whether these are mainstream or specially designed that allow people with functional difficulties to live as much as possible like anyone else. It's digital and non-digital. It increases independence, it allows for activity, participation, independence, and self-determination. You could say to a certain extent that AT is life-changing technology. It enables people to take their lives in their own hands and to more self-determine their life pathway, leading away from what others call predetermined destinies. Very important to know is that the technology component of assistive, I have to say this differently, is that when we talk about, increasingly we talk about assistive solutions, because the technology that support people in realizing those life projects are not just specially designed assistive products, which is more the traditional interpretation of assistive technology, but also accessible mainstream technology and products and services designed according to universal design principles. So when we talk about a person-centered technology or about assistive solutions that people use to enhance their participation and inclusion, we basically talk about a mix of all these three types of solutions. What are the main international policy frameworks for assistive technology? We all know the UN Convention, which is about equal opportunities. And India Convention, access to assistive technology and to assistive technology information is very much considered together with accessibility and universal design. So AT is interpreted as a sort of a human rights enabler. It allows people to access all the other human rights. It comes also back in the Sustainable Development Goals, which are very much about leaving no one behind. If we want to build our societies in a more sustainable way, we have to make sure that everybody can contribute, and assistive technology helps to make the contribution of everybody meaningful. The World Health Organization started a couple of years, about 10 years ago, in systematically addressing the challenges related to assistive technology provision. And through the GATE initiative that maybe some of you have heard about, the challenge is to make sure that assistive technology becomes one of the pillars of the work of the World Health Organization. And resolution of the World Health Assembly is actually calling upon governments to make sure that access to assistive technology is fully embedded in universal health coverage. But there are also initiatives from more the assistive technology community. When we think about the priorities for the future work, so what is the agenda that we want to drive over the next few years? The Bologna Declaration is a very helpful document. It was approved in 2019 during the European Assistive Technology Conference, which was held at that year in Bologna. The declaration is still on the website of AAATE, so the European Association, and it can be endorsed. So if you like, you can go there and read it and leave your endorsement for it. It's basically it's called Unlocking Human Potential, a call for action to improve access to quality assistive technology for realizing fundamental human rights and achieving the Sustainable Development Goals in a fully inclusive manner. So it's very much connected to what I said before. The declaration calls upon or sets 10, let's say, areas for action. First of all, awareness raising, but also to foster accessibility legislation with enforcement mechanisms. I'm not going to talk too much about accessibility because I know that after me there is the the Maltese representative in the Accessible EU project. So I suppose he will address the main challenges there. To promote socially responsive and responsible research. That's very important that we continue to do research in this field, but also that all research that is done is actually responding to let's say the question how people with disabilities could be involved and could be part of the populations that are being investigated. To assure that technological innovation is inclusive, to foster AT provision systems, to create appropriate and robust lifelong education opportunities. So here's the whole education and training aspect that has to be looked into. To work on the culture, on the positive image of assistive technology and the inclusion of people with disabilities aided by technology. To seek and to require meaningful collaboration between actors, which is of course relevant, because if we want to really make sure that assistive technology becomes accessible by everybody in the country, it involves more than just let's say the people that are specifically working on assistive technology. It also involves education, health sector, the social sector, the sports sector, etc., etc. To pursue and assure the quality of assistive technology solutions, so we need standards and to remove all other barriers of whatever nature. As already mentioned, a multi-sector effort is needed to boost access to assistive technology. There's a nice definition here of what advancements mean actually. And it reads, an increasing percentage of potential beneficiaries of assistive technology has access to appropriate solutions and uses these effectively for their independence, participation, and overall well-being. Now, if we analyze well that definition, it becomes clear how different sectors and different let's say knowledge components are needed in order to collaboratively work for driving this agenda. We need information about demographics. We need if we want to measure how actually the amount of people that might benefit from it and how well the access to assistive technology is realized in a country. The costs of AT is an aspect related to having access to it. Cost might be a problem, both for the production and the distribution, but also the provision. So that is an economic challenge, an economic problem. How we're going to make sure that everybody has access to that from an economic point of view. Appropriate solutions. It's not just about providing people with any solution. We really want to make sure that these solutions are appropriate. So we have to look into different factors that determine the appropriateness, both related to the person as well as to the health or related aspects. So here, health and social care services probably need to collaborate more together also with educational services to really have that holistic assessment of how technology can support the person. We want the solutions to be effective, so we need the support of the educational sector to make sure that there's training, there's opportunities for use available. For the independence and the independence of people, if people are independent, they probably need less support and care, and that means that there's also a positive impact on the domestic economy of the country. For the participation, and that requires again the involvement of the educational sector, but participation is also in employment, in political and cultural life, and overall well-being is more, again, related to overall welfare policies and to education. So what I wanted to say basically is that if we want to drive the agenda for assistive technology in a country, it's not just a question of looking into the what health is doing or the social sector is doing, or it's not only connected to rehabilitation. It's a much wider issue that needs to involve different sectors of the economy and of the state. Okay, something more about trends in digital assistive technology. I tried to list what, according to me, this is not based on any research or whatever, it's just a personal interpretation, what I saw basically changing over the last 10 years. First of all, there's a much wider spread of access to the internet. So the connectivity is improved a lot in all, basically in all homes now there is an internet access, but also in schools and of course in work settings, etc., etc. So internet is much more widely diffused than 10 years ago or 20 years ago only. The process of integrating accessibility features in mainstream technology is continuing. So there's a sort of a shift from increasingly from let's say challenges that people with disabilities might have in accessing digital environments that are being solved not just with specially designed products, but increasingly accessibility features allow that in mainstream technology. So, for example, operating systems that allow for catering for some of the challenges that people might have. The research into new human-machine interaction paradigms is progressing. So, especially in the field of voice recognition, but not only. There are some very innovative HMI paradigms like brain-computer interaction, although that's still lacking real applications. There's still continuously research done in that field and quite promising. Internet of Things is progressing, so there are increasingly environments that can be controlled remotely, based on sensors or other kind of devices that are connected directly with the internet, and that can be used for the collection of data, for example, to monitor people from remotely. Smaller, lighter, and more flexible materials, so which means the devices are increasingly wearable and increasingly, let's say, easier to use in mobile applications. Artificial intelligence and machine learning, it's a bit a topic of the moment, especially about a risk related to artificial intelligence. But there are also a lot of opportunities for the inclusion of people with disabilities. Robotics, here we can think about robotics for mobility assistance, for care, but also exoskeletons, smart prosthetics, and yeah, I think that's one of the areas where we will see in the near future the biggest developments. Then smart home accessibility, so the integration of assistive technology with smart home devices, also that is a field where there's continuously development, and augmented reality and virtual reality. There are already a lot of applications for learning experiences, for example, for people with mental health issues or with intellectual disabilities, but also for the training, for example, on the job. There's an increasing use of applications that can actually help people to use those immersive environments for the development of their competences and their skills. Something about artificial intelligence, because it's such a hot topic. I suppose you're all aware about it. I found this report of the OECD, which was presented at the last AAATE conference on artificial intelligence and employment for people with disabilities. But of course, the application of the content of that report is wider than just employment. It provides a nice definition of artificial intelligence. It's as a machine-based system that can, for a given set of human-defined objectives, make predictions, recommendations, or decisions, influencing real or virtual environments. So that characteristic that it helps to make predictions, recommendations, or decisions is actually the strongest innovation. It is based on human-defined objectives. So that means that it's still us that decide what we want the AI application to produce. The working of AI is basically related to the extraction of information from large data sets, and then based on that information, combining information and formulate those predictions, recommendations, or decisions. The report of the OECD distinguishes between disability-centered applications of AI solutions and environment adaptation solutions. The latter one being, for example, making information more accessible, rewarding, tagging images, or solutions that help the indoor navigation, because information about the environment is analyzed and provided in a usable format. Disability-centered AI solutions are more related to alternatives that are otherwise differently to be performed. So, for example, live captioning algorithms, image of object recognition, applications for self-driving wheelchair, where the environmental information is digested and leads to let's say decisions about the obstacle avoidance, etc., etc. But also solutions for interfaces based on face, gaze, or lip movement with a control device, or AI-based coaching systems for neurodiverse individuals. Like all technological innovations, there's always a sort of a challenge to see how people with disabilities can make best use of this. But at the same time, the risk of any technological innovation is also that it creates new barriers. We saw that with the touch paradigm. We saw it with all kinds of technology innovations. So the opportunities for AI are that it definitely leads to more personalized solutions. It better fits with the individual conditions and preferences of people. It's easy to integrate in mainstream applications, so it can help to scale accessibility, and it enhances the capabilities and the productivity of people. From that point of view, it might overcome some forms of stigmatization. At the same time, there are barriers based on these big data sets that are collected in the cloud, and crowdsourced data sets. Applications might not include all aspects of diversity. So the conditions of people with disabilities might lead to the fact that they are not fully considered in those data sets. They are outliers. So that means that, for example, the solution will typically not work well for them. An example is people that have very dysarthric speech, and that might have difficulties in being recognized by the application, because the way they articulate is actually not sufficiently close to what is the standard determined by the data set. So what we see is that both because of the development of the technologies, but also because of the way we perceive and the disability, there's a kind of a shifting perspective, and that is from access to assistive technology as specific solutions for people with specific problems towards a discourse which is more related to digital inclusion. That is important because we want to have increasingly our life is determined by digital technology and also by digital environments, and it's important that people have equal access to digital technology. That means that involves also access to digital skills, training resources for all, and to make sure that the effective use of digital technologies is guaranteed to all in education, in healthcare and employment, and in various other aspects of the daily life. So the concept of digital inclusive societies is connected to the promotion of an inclusive way of thinking to leave no one behind. It insists on the digital participation of all, and it allows for, let's say, a new approach to thinking in more inclusive terms, also when we talk about the design and the production of digital solutions and digital environments. This is an example from an European project, a Right to Connect project, which is actually aims to make sure that people with intellectual disabilities are not only have access to digital environments, but are also fully involved in the design and the development of digital environments, but also digital training is based on a peer-to-peer educational model, and all the materials and the e-learning platform that has been developed are co-designed together with people with intellectual disabilities. It's a very nice project, and if you have the opportunity to go to the website, you're warmly invited to do so. So, in order to create digital inclusive societies, we need to close the digital gap. We need to bridge that digital divide in order to allow people full participation in all areas of public life, so whether it's government, access to services, education, and employment. Now, how can that be done? How can some of the barriers for digital inclusion be addressed? In the Antilles project in 2016, sort of a systematic effort was done to see how we could develop AT capacity programs at all levels and in all sectors. And the suggestion was to set in motion a kind of a process from assessment leading to the development innovation and to the consolidation of what works. That's, of course, a never-ending process. So whenever you assess that there's a barrier, for example, in education and access to digital content for children with disabilities, you say, okay, this is a problem. You try to develop a solution. You test whether it works, and when it works in practice, you try to consolidate it in everyday practice. There is a digital inclusion roadmap produced in that project, laid down in the white paper that you can find on the internet, and you can see how it, for example, could work out for different sectors. For the educational sector, the social services, the more technology-related sector, and the wider policies. Goals are set in this roadmap. For example, in education, that schools and vocational education centers are fully prepared to support all learners in their ICT needs, with the, of course, the highlighting the word all learners. In the social sector, is that the sector is aligned with digital society and supports citizens with assistive technology needs. Technology is that products and ICT-based services are designed or made accessible for all. And in the field of technology is that digital inclusion is mainstreamed in all policy frameworks and programs. Then the roadmap further identifies a couple of, let's say, issues that need to be assessed, suggests areas for development and innovation, and defines strategies for the consolidation of the progress. So when we, how much time is left? Okay, 15 minutes. When we think about boosting access to assistive technology, and we think about how, as a country, as a nation, we could develop an agenda to drive that, to drive that process. It is important to apply a system thinking approach. Now, the World Health Organization here provides some support. In the global report on assistive technology, this let's say this image is reproduced, and 5 areas are identified as particularly relevant to provide assessment and work. These 5 areas are considered interrelated and interdependent concepts that together, addressed together, might boost access to assistive technology. So the people in the center, which is quite obvious. So the client or the person with a disability or the older person, is their interests and their needs should be in the center of concern. But there need to be products available, there need to be trained personnel, there need to be a provision system in place, and there need to be policy that actually brings this all together and make it sustainable. There are different tools to assess the AT capacity at national level. I don't know whether this has ever been done for Malta, but there is the ATAC survey from the World Health Organization, which is a assistive technology capacity assessment tool that can be used. It's mainly used by researchers or by ministries to assess the capacity of the country to finance, regulate, procure, and provide assistive technology. And we have the UNICEF Assistive Technology and AAC Capacity Framework and Toolkit. That is interesting because it specifically focuses on the needs of children with disabilities throughout their life course and across different settings, so home, school, and community. It is, let's say, developed for the European and Central Asia Regional Office of UNICEF, and it focuses specifically on the situation in low and middle income countries to improve their national assistive technology provision systems. I know Malta is not a middle income country. However, I think it is still quite relevant for all countries in Europe to use the toolkit and to check where they actually stand when it comes to the capacity of the country to provide answers to children and families, or children with disabilities and their families. Here's the link. It can be downloaded from the UNICEF website. This is already said, and the interesting thing of the framework is that it enlarges a little bit the approach to only look at 5 domains in addressing the assistive technology capacity of an ecosystem. So it's not only looking into whether what is the situation of people and what are, let's say, the wider policies, what are the products that are available in the country, how is the provision system organized, what is it done in terms of training of staff, but it adds also other areas of assessment, in particularly the PACE, procurement and place. Now, PACE, for example, is related to the timing of assistive technology intervention. When does it come? Is it regularly, are the choices made around assistive technology regularly reviewed, et cetera, et cetera? The timing is very important in assistive technology provision, as you probably all know. And from that point of view, the capacity framework of UNICEF is going beyond just the 5 P's as defined by the World Health Organization. The framework sets high-level performance descriptors for AT ecosystems supporting children with disabilities. And that's interesting because it actually allows you to assess, to measure, to understand where you actually are. So these are sets of performance descriptors that depict the kind of ideal situation. And for people, it says that needs are identified as early as possible. Early intervention, we all know the importance of that. Policy that access to appropriate assistive and communications technology is guaranteed. So there should be a sort of a state involvement, or state should guarantee that there are mechanisms in place that actually guarantee that access to appropriate AT and communication technology is there. A range of AT and AAC projects should be available in a country. I know that this for smaller countries might be a problem sometimes. That there's supply and support that is flexible, efficient, competent, and also looking into outcomes. The more performance descriptors of AT ecosystems when it comes to personnel are that the professionals are actually have the skills and the knowledge and the attitudes to implement AT and AAC solutions into practice, that intervention is timely and adapts to the changing needs of a child. This is actually what makes it also more slightly different compared to adults, although of course also adults will have definitely changing needs over time. The place the ecosystem can cope with different settings and circumstances, so it's not only related to education, and as soon as you're out of education there's sort of a drop and nobody's nobody looking anymore into your assistive or support you in your assistive technology needs. But also that it can be used both, that the technology, for example, can be used both at homes and in the schools, so that it's bridging the gap between different settings and circumstances, and that there are partnerships in place, so that that professionals and in different roles work together for the best interest of the child. The framework comes with a toolkit, so which is basically repeating that goal, and at the same time defining all kind of areas where assessment can take place. We're not going to read them all, but for example, when it comes to people, you might collect data about the different, so how is the disability defined in the country? What data do we have on the incidence, the age, and the needs? What are the expectations? What are the cultural factors, for example, present in the country? Is there still discrimination, stigma, institutionalization, etc., etc.? I will go fly over this, but just to show that for all these areas, there are sub areas where assessment can take place. Another interesting tool is the NTEL self-assessment framework for schools. And that is a tool which was developed again in the NTELIS project. It is looking into how schools are doing in supporting learners with disabilities, specifically in their use of digital technologies and strategies in inclusive educational settings. There are different domains identified with progress indicators, and the tool can be used by teachers or school managers to identify where there is already some good practice in place or where there could be improvements. It also helps teachers to develop intervention plans, or school staff to develop intervention plans, and the tool is best done probably every 1 or 2 years to see whether it's actually compared to what was assessed some years ago, whether their progress has been made. I just want to say the last couple of minutes something about digitalization in care and support services, because I suppose for the Aġenzija Sapport, this is also an area of potential area of intervention. We all want that our care and support providing ecosystem, so for both for people with disabilities and older adults, provide integrated care. So try to bridge the gap between silos of so the health sector, the social sector, the educational sector, etc. We expect from them that they provide quality, that they are sustainable, so financial and from a social perspective, that they are secure, so that data are protected, that they are resilient, they can adapt and they can cope to change. There's a lot of opportunities here provided by digital technologies when it comes to providing the integrated care services. One is the empowerment, of course, of the service user, but it's also about the organizational level, the communication, the coordination among actors, the effectiveness and the efficiency in the system, and the capacity of the system to produce data that can be used for the better planning of care and for preventive reasons. So the outcome of the use of technology, of person-centered technology in integrated care, is that you have an active role, more active role of the user, that it can support interventions when and where needed, and that it can lead to the use of new and innovative services. Of course, they need to be accessible. Otherwise people can't use them, which means that they need to be available, acceptable, and affordable, that they look into physical accessibility and cognitive accessibility. Here are the strategies for improving accessibility, but maybe I'll leave that for the next speaker. And the final slide is related to the Shapes project. In this Shapes project, we have looked into core factors for high quality and accessible person-centered technology enabled services. So if you want to go on that roadmap, on that road of providing your care and support services increasingly in a digital way, there are a couple of factors that need to be considered. So the outcome of the research done in the Shapes project is this list of factors, and that is that in any technology adoption process in care, it should be assured that the solution is functional from the end user perspective, that the beneficiary group is well defined, that the technologies are safe and secure, that the interfaces are easy to use, that the technology actually links the needs of people into different care domains, so health, social, and education, that the concept is person-centered, and that it will be piloted before full deployment. This document is currently circulating among members of the European Parliament. I will send a copy to Support, because it would be good, I think, if you can promote it among your the Maltese members of the European Parliament. It was initially promoted by a Finnish member of the European Parliament, Sirpa Pieta-Kainen, that you can see here on the top left of the slide. It lists all kind of priorities and activities that have to be done, that we have to address together if we want to make sure that Europe is an increasingly continent where care is provided for the benefit of all, and in using as much as possible technology for a better quality of life of the citizens. That's it. Thank you.
Thank you very much, Evertian. That was really interesting, and thank you for giving us an overview on the different assistive technology that's available and for all the resources. We'll be taking some questions then during the question and answer slot that we have.
Okay.
I would like to let everyone know that we will not be sending out presentations. However, the recording will be available on YouTube, so you will be able to access it that way. So our next speaker is Dr. Joseph Spiteri from Accessible Europe. Dr. Joseph Spiteri has been active in the field of accessibility for the past 25 years, and his work in this field has largely concerned access to the physical built environment, and he has helped in drafting 3 editions of the Access for All Design Guidelines in the Maltese standards. So I'll be giving the floor to Dr. Joseph Spiteri to tell us about Accessible Europe now.
Okay, thank you very much, Theodora. I'll just start sharing the screen. I have a few slides. Okay, so good morning, everybody. My name is Joseph Spiteri. First of all, I would like to thank very much the organizers, Aġenzija Sapport, for inviting me to say a few words regarding the Accessible EU platform. It's a new initiative that started really last year under the auspices of the European Commission. As we can see from the slogan adopted by the European Accessibility Resource Centre, it's about working together to build a more accessible European Union for persons with disability. The obvious emphasis is on working together and bringing together the myriad of professionals, academics, researchers, service providers, and basically all those involved in some form of accessibility within the European Union, and provide a platform for bringing all this knowledge together. In fact, it's basically excuse me, a response to the rather fragmented nature of European standards on the various aspects of accessibility and the different policies that surround accessibility. We all have to adhere to one set of legislation, which is the EU directive, which is European legislation, but also to national regulations and national legislation and regulations. So adhering to standards, adopting good practice is rather fragmented within the member states of the European Union. So one of the flagship initiatives of the European Commission's strategy for the rights of persons with disability that runs for the 9-year period between 2021 and 2030. So we're more or less at the front end of this period. And the strategic objectives are basically to increase coherence in accessibility policies. So moving towards, let's say, more uniformity among the member states, to facilitate access to relevant knowledge. So to bring together all the different pieces of the body of knowledge. And I was very impressed by the previous speaker presentation, which obviously highlighted many pieces of the knowledge base. And this is one of the aspirations of the Accessible EU initiative, is to bring all these pieces of knowledge into one platform. So it's also considered as a move to a coordinated EU-wide approach to accessibility, and this is in line with the overall EU aspirations of harmonization of standards, of policies, of approach. And it also attempts to provide a one-stop shop, so all those interested in these fields don't have to trawl through different websites and different documents to look for particular pieces of information. and the aspiration and the hope is that all these pieces of knowledge will be available on this platform. The way the Accessible EU is structured, as I said, it's an initiative of the European Commission. It is being coordinated by 5 organizations. You can see their logos there, mainly by Fundación 11, which is a Spanish disability organization, but there's 4 other organizations, ENAD, ESPD, Johannes Kepler University, and UNA, which is the standardization body in Spain. Every member state is involved, and there's a focal point which they call national expert. And I don't consider myself an expert on anything or everything in accessibility, but that's the nomenclature that the Accessible EU has decided to adopt for the focal point in each member state. So the way that the Accessible EU program has categorized accessibility issues are those 5 there: the built environment, the physical built environment, transport, information, communication technologies, and policies. Clearly, as I'm sure you are all aware, there's a lot of crossovers between these topics, and they're by no means self-contained topics. For example, my field, which is basically, as has been said previously, in the built environment, but the idea that we can have an accessible built environment without due regard to assistive technologies is obviously not on. Part of making the built environment accessible is not only a question of ramps and lifts, etc. It's also a question of the assistive technologies, which of course this conference is all about. And in order to achieve those strategic objectives I've just mentioned, there are a number of operational objectives of the Accessible EU program. One is to build capacity on accessibility in new countries. It's sort of a kind of leveling up of all the capacities and taking advantage of the advancement in different countries in different aspects of accessibility in the different fields that accessibility surrounds, and at different levels, at policy level, at regulation level, at technical level, and of course, most important, at implementation level, because all these things on paper or on documents are useless unless they are actually implemented on site. So another operational objective is to support the implementation of European legislation on accessibility, and also within that support to implement the European Union legislation, there is also the idea of the harmonization of standards and approaches across the member states of the European Union. A third objective is to connect stakeholders like we are all here and all the attendees of this conference who are responsible for implementing accessibility rules within the EU. And this is obviously the whole objective of this is to share experiences, to learn from each other, and what is done in one country can be shared with all the others. It's also there to create a common European one-stop shop on accessibility. I've also mentioned this earlier. It's a question of having a repository of knowledge available in one place, and obviously to train professionals on accessibility. And many people involved in accessibility have already a primary level skill base. in the case of the built environment architects and engineers, but there is a higher or a second level of skill base which relates to accessibility. We can say the same for professionals in ICT and software development and AI development, where the primary skill base related to the technical parts of software development have to be augmented by an awareness and a knowledge of how to make those artifacts accessible for all. So the way forward, that the Accessible EU programme is offering is organized on 4 pillars: an online library, which is available to everyone, and it is being brought together by calculating information from all member states. So we can see it as a repository of knowledge. Networking events and networking programs which allow the transfer of this knowledge. Training, accessibility training, which allows the imparting of this knowledge to others. And also, I would say, highly significant, accessibility monitoring and surveillance, translating all this knowledge into actual artifacts, whether they be their buildings or websites or services that are accessible on the ground. This is the outward face of many of the internal workings of Accessible EU, and within the portal there's 4 sections: and news part, which attempts to bring to the attention of all those who are interested the latest issues in accessibility on the different aspects of accessibility. Events, providing access to events in different European countries, like this event and many others across Europe, providing all those interested in access to them. So it's not necessarily events organized by the EU program, the Accessible EU program, but all other events which are obviously of interest on a pan-European basis. The digital library, I've referred to this earlier, which is a repository with the most relevant materials about accessibility in Europe. And there's also a section on good practices, where there's a list, there's examples of good practice across the member states, and these are provided by the different countries. I just put up there in this slide examples of what we can find in terms of on the digital library, and there's the web link to different documents and videos and policies. So I mentioned here the accessibility guidelines for mobile applications. That is a Spanish initiative, and the benefits of virtual and augmented reality for people with visual impairments, which is an Austrian document. We have, from the Malta side, we have uploaded a number of good practices and documents, and those are 2 examples of the various that have been uploaded. We uploaded the national strategy, and we also uploaded good practice that we have in Malta. One example, so the accessibility of the Haltarshan Prehistoric Complex, which is UNESCO World Heritage Site. So these are the kind of stuff. Obviously, we are interested in especially stuff that people attending this conference may know about in terms of digital. Somebody's slamming something here. Digital assistive technologies. So good practices. We are obviously very eager to have these uploaded on this common EU platform. The third pillar, networking. The second pillar, networking, and this is conducted at national level and international level. And again, one of the mainstays of this Accessible EU initiative is sharing of experiences and knowledge related to the different aspects of accessibility. And also, as I've said, accessibility training in terms of workshops, online trainings, mutual learning events, and even obviously events like this conference. It's a learning experience for everybody. And that's why we have an Aġenzija Sapport has very kindly accepted to have this within the Accessible EU program. There is, I'll bring to your attention, the first training opportunity is Accessible Technology Design, which is being held between the 15th November and the 15th December at what's called the Accessible EU Campus, and I put down the website there of anybody who might be interested in seeing what that's all about. I'm just putting a note here about another awareness raising event that we've held in Malta, which was held about 2 months ago, and it was regarding accessibility for all for construction managers. I said this is not about the physical built environment, which might have been my bias, but obviously we're very much interested in including now ICT, digital assistive technologies within this program, and also showcase what we are doing in Malta on a pan-European platform, and also obviously accessing that platform to gain knowledge and experience that was carried out by others. And the final pillar is about monitoring and surveillance. We know this from experience. Well, I know this from experience in the physical built environment. We can have guidelines, we can have regulations, legislation. The proof of the pudding is what is actually in place on the field and what happens. So having all this skill-based, knowledge base, as I mentioned earlier, is not really, it's not really worthwhile unless it's actually translated into a more accessible environment, whether it's a built environment, whether it's an information or communication environment. And for this purpose, the Accessible EU program is preparing a number of documents. So far, 5 documents have been prepared, and these are more or less geared towards having a concise and easy to use guidelines, providing knowledge about EU legislation and standards, because at the end of the day, of course, we are interested in making life better through accessibility initiatives. But that's not to say that we are also required to adhere to EU legislation. And those are the 5 guideline documents that have been prepared so far. They've been prepared earlier this year. There's one about digital accessibility, and I've put there the website for those of you who might be interested in seeing what they're all about. So far it's going to be a 4-year program, this Accessible EU. What's happened in the last year, well, really mainly it's been launched in May. A number of training events and networking events have been held across Europe. I haven't put down the number because it's constantly changing, and in October, November, there was a large number of these events taking place. 500 new members in the community practice are organized under this program. So far there are 60 entries in the online library. There's actually a bit more now. And 5 good practices from each member state. So the library, as of today, has about 135 examples of good practice. Now I'm going to conclude now. The next steps is to continue to build on this online library of good practice and publications. And this is where I would like to ask, all those of you who have authored or know about good practices in Malta and publications, to let us know about them so they can be included on the online library. To continuing to promote events like this one on accessibility issues, and also have an enhanced involvement in European standardization process. We know in order to adhere to legislation directives, European harmonized standards are required, and it is not a topic that should be treated lightly, especially because of the legislative and financial implications of these standards. And of course we are tasked to further collate data and publications. So as I said, I invite all of you who have or know about this, who have authored or originated information or know about them, to let us know. Everyone active in the field of accessibility and disability rights are invited to contact me to learn more about the Accessible EU programme. There's my email address for those of you who would like to involve. And here I put up this slide. I'm not going to read through all of it. This is who can participate, and therefore we have a list of private and public companies, business associations, persons with disabilities, public administrators, procurers, NGOs, providers of services, assistive technology providers, built environment professionals, and universities. So this gives an idea of the kind of organizations and people, which is basically everybody in the Accessible EU program. They have put up the website of the Accessible EU Centre, the email, and there are obviously various entries in Facebook, LinkedIn, Twitter, or X now, and YouTube. So, thank you for giving me this time, and that's it from me.
Thank you very much, Dr. Spiteri, for the presentation on Accessible Europe. Our next presenters are going to be Joyce Grech and Maurizio Salerno, who'll be talking about assistive technology in education in Malta. Ms. Grech has served as acting head of education for 22 years, head of Education 22, head of the Malta Drama Centre, executive director of the National Book Council. She has also hosted various television shows and radio shows, and has worked for the policy development and project implementation for different ministries. And we have Maurizio Salerno, who is currently the head of department at the Specific Learning Difficulty Service, Directorate for Early Years, Languages and Humanities. He's also is a Reading Pens board member and has contributed to various educator training initiatives related to dyslexia. So I'll pass the floor to Ms. Joyce and Mr. Maurizio.
Morning, everyone. Thank you for the invitation to Aġenzija Sapport and all our colleagues working in the field of inclusion and technology. I'm going to try to share my screen, but I think the previous presenter.
Dr. Spiteri, you need to unshare your screen first for us, please.
Okay, so thank you, Theodora, for the introduction. The title of our presentation today is Unleashing the Potential of Every Learner, OTPC and beyond. OTPC here refers to the acronym of the European project One Tablet Per Child, where as part of this European project that the Ministry for Education embarked on, there were a number of initiatives that could be beneficial to all students in the primary level from year 4 to year 6. In fact, the initial idea of distributing tablets to include students with diverse learning paths was the initial objective of the project. But as the project went along, there were new needs that came into the fore. And of course, there were different measures that were implemented. I will be starting to share some of the objectives of the project, but also the measures that we managed to implement. Coincidentally, the One Tablet Per Child project is nearing the end. We are at the final month of this project, so I think it is an ideal time to reflect on the measures that we introduced and the sustainability of the project. It's not true. Okay, just a moment, because I'm trying to change the slide of the presentation. Okay, so okay, so this is an introduction to the project that, as I said, started in 2016. As you can see, these are the main topics that we will be discussing briefly today and focusing mainly on the measures which incorporate inclusion as their main priority. So the One Tablet Per Child provided a tablet for usage for all students between year 4 and year 6. We also had the measure of the distribution of the exam reader pens, which my colleague Maurizio will be speaking on later on. We also provided the virtual reality headsets for all colleges and resource centers. And finally, we will be giving some information about the content, the contact information of our directorate, that if you have any questions or suggestions on how we can improve, of course, you will be most welcome to contact us. As an overview, our directorate has the main objective of providing technology in schools, within the school environment, but not only, because most of our technology is portable in the fact that it's not kept within the school environment, but it's also taken home by the beneficiaries, by the students in this case. As a directorate, we have two main arms. Our staff is partially coming from the education sector, where they provide pedagogical advice both on a national level, but also within the school environment. And then our other arm, equally important, is the managerial, that manages our capital projects, that provides all types of technologies in schools. We also participate in many national events in order to reach as many parents and indirect beneficiaries as possible. And finally, one of our main aims also is to constantly train educators, parents, students, but also any other beneficiaries of our project, and create awareness campaigns. So as an introduction to the project, it was very important that we defined the main objectives of the projects, the main targets, and how we will be monitoring the achievements in every target. And these were some of the objectives of the One Tablet per Child project. Interestingly enough, although many member states face the same issues that we do when it comes to, for example, early school leaving, one of the objectives of this project is to increase not only the accessibility to learning, but also the flexibility to create tailor-made learning paths for our students. As we all know, we are all individuals. We do not learn in the same way. We do not absorb information in the same way. And therefore, having technology was very important for us to create this flexibility in class. Many teachers tell you that when they are delivering their class, they try to address the different learning needs of the students that they have. And therefore, the technology helps in this way to, as much as possible, assist in providing different ways of absorbing information. We also noted that in the reporting that we have to ask, but is very insightful for us, many teachers found that they found a newfound flexibility also in the learning environment. We saw a number of increases of, for example, lessons being held in different rooms within the school, outdoors, the way that information flows from the teacher to the student and from the student to the teacher has changed over the years. And as we go along and with the increase of digitalization, we envisage this to increase in the years to come. So these are some of the initiatives that were held as part of the One Tablet per Child project. As I said, we gave the tablets to all students. The virtual reality headsets, since the budget was limited here, we could not deliver the headsets to all schools, but they were given to each college, and then the head of the college network decided on the mobility of the sets within the school. We also had the headsets delivered to the resource centers and had also specific training that went with the technology for the resource centers and for the staff working there. And also the exam reader pens for students who were facing difficulties in reading, that Maurits will be delving much more into depth into this measure. We also had the software. One of the leading software that we had developed specifically under the One Tablet per Child project was Octavo. That meant that many of the literature books in the Maltese language were digitized and accessible through the tablet. There was also the cloud-based ecosystem that provided also methods of communication through digital means for teachers and students. Another activity was the ELET Master's Programme for Educators, which was a master's program developed to understand where we are in terms of early school leaving and to design the roadmap for the future. Catch-up classes, as we all know, that during the COVID time, many students fell behind because of a variety of reasons. One of them being that they were not used to online teaching and learning. So the ministry had decided to create what we call catch-up classes in all the core subjects. These catch-up classes were attended in all centers, very well attended. And what happened was that even when COVID had passed, they felt that it was very important that the catch-up classes continue. And in fact, they are still going on to this day. We also constantly have training sessions for educators and parents. It is very important that we keep information going because, of course, the parents change, the educators change. Sometimes they change sector from primary to secondary. So this training is ongoing. And the awareness campaign for the project. The distribution of tablets was and still is going throughout the scholastic year. Of course, we also request feedback on how they are being used, how much they are being used, and we are constantly finding ways of how to integrate technology through the curriculum. As we know, digital literacy is a transversal skill that is transpired through different subjects. So in recent years, we have also discussed with many different education officers responsible for certain subjects of how to provide the teaching not only through traditional means, but also through the digital world. The distribution of VR headsets, as I said before, was done through the various, to all colleges, but at the moment there are training and that is happening to new educators, and we are also developing new software programs that can be used through VR headsets. When it comes to resource centers, a reporting system is in place where we receive feedback of how they are being used, how they are introduced to students with different disabilities, and we work with the various professionals in the field to address those concerns. VR is something that is growing in popularity. Many educators are constantly asking us for new content, especially content related to Malta, which has some relationship to our country, but also looking for new software programs that can be used and pegged to items that are part of the learning outcomes or part of the curriculum. These are my details should you wish to have more information about our directorate and all the projects that are happening at the moment. We are also looking into the possibility of increasing our work in the AI field, because this is a growing need, not just in Malta, but in all member states, and also continuing the project of the 1 tablet per child beyond the EU funding programme period. Our director as well is embarking on a new project. We are hoping that our application will be successful to extend the 1 tablet per child project into the secondary year, starting from year 7 upwards. So I will now be giving the floor to my colleague Maurizio, who will be speaking a bit more about the exam reader pen initiative and how this is impacting our students and educators that are using and are part of this initiative.
So thank you very much. Thank you very much, Ms. Greg, for the input you gave. Also, thanks for Aġenzija Sapport for having invited us to contribute to this conference. I mean, it has been very interesting so far, so thank you for that. So basically, I will attempt to give you an overview of the Reader Pens initiative in state and church secondary schools. This initiative started 3 years ago, basically, and the intention is that those learners, those students that have difficulties in reading are given the possibility to use assistive technology, to use reader pens in this case, to have better access to the curriculum and also to improve their independence. Something which I would like to mention is that this initiative is a joint initiative between the Directorate for Early Years, Languages and Humanities, together with the Directorate for Digital Literacy and Transversal Skills. Now, I would like to give an overview of the various points that we shall be mentioning in this brief presentation. Initially, as already explained, I'll start off by giving an overview of how the initiative is moving on so far. We'll also have the possibility to explore and discuss the benefits of this assistive technology for those students who are encountering reading challenges. And we'll also have the possibility to address the identified challenges from the annual feedback that is collected from participating students, their parents, as well as educators. And then we'll actually give a snapshot of what the plan is for the years to come. So, as you can see, the reader pen that students are making use of in our secondary schools is the C-Pen exam reader pen, the one that you can see on this slide. Now, the core function, the main function of this device is to scan text that can be found on the student textbook or on a handout or on a test or examination paper. And by scanning the reader pen on text, the text appears on the screen and that text is then read out to the student who has these reading challenges. So the core function of this device is to give better access to text of those students who are encountering these reading challenges. The device works and has multiple languages as options. Students can set the device to read English, French, Spanish, and several other languages that our students learn at school. Unfortunately, as yet, this device does not have the possibility to decode, to read the Maltese language. And in fact, as we shall explain later on, from the annual feedback that all stakeholders are giving us, this is something which obviously needs further work, because the need to have this device as well that is able to read text in Maltese is of utmost importance. Now, I would like to place some emphasis that even though this device is referred to as an exam reader pen, the aim is not for students to use this assistive technology simply during examinations or assessment, but the aim is that this device is incorporated and used on a day-to-day basis by the learners, okay? Using this device in an exam should be simply an extension of what the student is normally accustomed to. So this is something which I obviously wanted to emphasize, to clarify that we are encouraging students to use the reader pen whenever they come across difficulties to access text. Presently, we have over 600 students who are in years 10 and year 11 in both state and church schools. who are making use of this technology. The equivalence in terms of age, years 10 and year 11, we are talking about students who are between the ages of 14 and 16. In all, we have 36 secondary schools who are participating. There are 16 state secondary schools, including 1 learning support center and 20 church secondary schools. Something which I would like to mention at this point is that for a student to request a reader pen, there is a certain procedure. Okay, there is what is referred to as a reading pens board, which is made up from different professionals within the education sector, mainly educational psychologists and dyslexia specialists, and together with various stakeholders, mainly the school psychological service, the specific learning difficulties service, as well as professional educators from the Secretariat for Catholic Education. There is a procedure where RPB and these services guide schools to be able to identify those students that are eligible for this device. What happens is that during their educational journey, students who have specific challenges in literacy, assessments take place. Assessments that basically gauge the reading level of students as well as their comprehension skills, and in doing so, a set of criteria have been established to identify those students who have this particular need. In fact, at this point in time, we are in the process of guiding schools to identify those students who might possibly want to request a reader pen, and this procedure should kick in sometime at the beginning of term 2 of the present scholastic year for year 9 students. So we're talking about students who are around 13 years of age. So in the first year of this initiative, so we're referring to scholastic year 2021-2022, training was initially provided to educators from all secondary schools. Then subsequently, training was provided to parents and students in term 2 and term 3. At the time, we still had certain restrictions related to COVID, so all the training provided was given online during live sessions, but we also had recorded training videos that were used eventually even to fill in some gaps in the training provided to some students who could not actually attend. Last scholastic year, we had 311 year 9 students who requested the use of a reader pen, and were also provided with the necessary training. This time, the training provided was in person at the respective schools of these students. Last May, we also held a national awareness conference, and various stakeholders attended during this conference. One of the aims was to increase awareness of how this assistive technology could possibly help individuals with reading difficulties. In fact, on the same day after the national conference, the Directorate for Digital Literacy and Transversal Skills hosted workshops for parents and students, and were given the possibility as well to try out the device and also possibly engage and see how this technology could be put to good use to those individuals who are encountering these reading and comprehension challenges. Furthermore, last scholastic year, so we're talking about 2022-23, from the feedback collected, we realized that we had a number of Year 10 and Year 11 students who, even though had the reader pen for close to one scholastic year, they were still encountering some challenges to suitably use this assistive technology, both at school and at home. So to address these challenges, specialist teachers at SPLD service, as well as educators who are involved mainly with providing support in digital literacy, met up with these students to provide sessions in small groups to be able to address the identified challenges. And following these sessions, in fact, the response received was positive, and I mean, various stakeholders, including educators, actually indicated the importance of meeting up with students in person to actually better understand the challenges that they are experiencing. So what are the benefits of this assistive technology for students with reading challenges? So primarily, as I think most of us would agree, one of the main aims of using a reader pen is to promote independence. When a student is at school or at home and the learner has difficulties to read text, difficulties to access text, the reader pen is giving that independence and autonomy that should ensure the learner to be able to access the needed text independently. Consequently, this also helps to improve access to the curriculum. We know that students who have reading challenges, obviously, without additional support from educators or from assistive technology, will be placed at a disadvantage compared to their peers who do not have challenges in this area. The fact that this device has access to multiple languages is obviously an added benefit, even because, as you know, our learners also have foreign languages, and in schools they learn possibly other languages like Italian, German, Spanish, French, Chinese as well. So the reader pen gives better access even in that case. As already mentioned before, unfortunately, as yet, we don't have access to the Maltese language in terms of text-to-speech on this device. This device, if used appropriately, can also improve student attainment. And consequently, even in the context of an exam or an assessment, it helps improve self-confidence and also possibly exam anxiety. Now, some additional benefits on the use of the reader pen in secondary schools. First of all, if we have more students with reading challenges who have access to this technology, schools can make better use of human resources during examinations and assessments. Up until this point, whenever a student had a professional report by an educational psychologist or possibly a dyslexia specialist indicating the need of a reader in examinations, a school would need to provide a human reader. So an educator, a teacher, a learning support assistant to read out the rubrics and to read out parts of the examination paper to the students. With the introduction of a reader pen, if the reader pen is used appropriately in this context, that will definitely help alleviate some staffing and logistical issues that we come across in our schools. Obviously, we are still in the initial phases of this initiative, so the uptake, even in terms of using this assistive technology in examinations, can improve, and there is space for improvement. Furthermore, as from this year, you might be aware that Year 9 students also have what is referred to as school-based assessments. Okay, these school-based assessments can take various forms. They can be tasks that are done in class. They can be tasks that can be carried out at home, but possibly educators might want to give an assessment or a test in class. Now, if a student has reading challenges and he has access to a reader pen, that should give the student better accessibility to the task at hand. So obviously, as educators, we are encouraging learners to make the best possible use of this assistive technology to be able to ensure that they are getting the best possible experience within this context. Now, in terms of identified challenges, as already pointed out previously, we carry out annual feedback. We request annual feedback from all stakeholders, including the students themselves, their parents, and educators. And the main reason why this feedback is collected is for us to get a better understanding how this assistive technology is helping our learners, but also the importance of being able to address the challenges that are brought to our attention. Recurring feedback year after year for the past 2 years has been the need to provide an option whereby the Maltese language is accessible on the reader pen. Okay, that is something which we have taken up in various fora. Obviously, Maltese being a language spoken mainly here in Malta provides certain challenges to make this happen, but we are adamant that we will continue obviously insisting that this is a need which needs to be addressed. Something else which as educators we are constantly promoting is that we need to move away from a one-size-fits-all approach. We are of the firm belief that even though the reader pen is a good option for a number of students, it might not be the best fit for some others. As learners, we are all individuals. We all have our learning preferences. We all have our individual needs. So even within this context, grouping together all students who have reading challenges into one cohort, which automatically means that the reader pen can be a solution, in our opinion, that is not the correct approach to take. In fact, we have learners who have severe reading challenges, and possibly for them, the reader pen might not be the best option. As we know, there are alternative text-to-speech options, which hopefully will be available as another tool to our students in the years to come. We also had some feedback as well relating to students who have issues with fine motor skills. As already indicated, to use the reader pen effectively, the student needs to carefully scan the text correctly. So if the student has issues with fine motor skills and issues to scan a sentence accurately, obviously the reader pen will not read the text correctly. So that is another issue which one needs to keep in mind when recommending this device to students. And also something which is also very important, it is learner preference. So it is within this context that as educators, as specialist teachers, we are all out to promote a toolbox approach in our schools, whereby educators and learners should have access to various devices, to various assistive technology options, which obviously can suit the very needs of our learners. So that is something which we firmly believe in and which we definitely promote in the work being done in our secondary schools. Another need and challenge which we are attempting to address is the need of more training opportunities for educators and how this assistive technology can be incorporated in everyday teaching and learning situations in our schools. So I would like to conclude this brief presentation by actually referring to this statement, which is some food for thought for the participants of this conference. So the appropriate assistive technology, when used intentionally and with clear learning objectives, can facilitate the removal of barriers to learning. So something which we firmly believe is that an important role of assistive technology in schools is the intention to remove as many barriers to learning as possible. This will help create more equitable learning opportunities that cater for the diverse needs of our students and learners. So once more, thank you very much for the possibility of sharing this information on this initiative. On the present slide, you have some contact details of SPLD service, should you wish to inquire about any points mentioned during this brief presentation. You also have our contact number, as well as my personal work email, which is included on the slide. So I will now pass the floor to Theodora. Thank you very much once more.
Thank you very much, Joyce and Mauricio. So we can go into questions. I can see that Joyce is answering some questions. I'm not sure if Evertian is still with us. Yes, okay. So we have a question for you, Evertian. Someone asked if you could explain the lectures a bit further that you had mentioned and how somebody can join those lectures.
I'm not entirely sure what the person, I think it was Roger, wasn't it, was referring to. But I've sent him my presentation so he can look at it, and if he wants more information, I'm here to. He has my email.
Okay, great, thank you. So now we have questions for Joyce and for Maurizio. So the first question is the training done to individual cases, or else is it a generic type of training?
So initially, when students request to use a reader pen, training is provided in the context of a group. So we have groups of students, 10, 12 students, and they are given the possibility to try out the device and at that point in time address any challenges they might be coming across. Eventually, when the student is using the device at school and at home, if there are any additional challenges, obviously students, parents, and educators can always inform us, and we will be able to address those needs on a case-by-case basis, and even if needs be on an individual basis.
Okay, thank you. The next question is, can assistive technology be enabled on the provided tablets if needs be? For example, the screen reading capability talkback.
Okay. In terms of training on tablets, we constantly ask for feedback from beneficiaries in order to determine the exact needs of training. As a general rule, we have training which is for mainstream that happens every beginning of the scholastic year, and then on and as the need arises. For example, last October, we had a full month of training for new teachers, for teachers who transfer from primary to secondary, but also we receive requests to create tailor-made training, not only on the tablets, but on all types of technologies that we have promoted through OTPC or even through other projects that the Directorate has. So if there is a training need that you have identified, that you think that we can contribute, I suggest that we discuss this training need specifically in order to, first of all, decide when is the appropriate time, the type of training to be given, but also the type of trainer. Most of our training is done by our heads of department for digital literacy. But if the need is even more specific to a target group, we might work with other entities, with other ministries to create the perfect training session for that specific group. So I invite them to communicate with me, and we will for sure design a training program appropriate for the training need identified.
Thank you. And we have a few questions about the tablets. So let's start with how are the needs of children with difficulties to access a touchscreen or a mouse addressed?
So in our training, of course, we not only show them the technical aspects, the main technical aspects of the tablet, but also we discuss pedagogical needs. A teacher is not only there just to operate the tablet, but also to use the tablet as a learning method and share different types of software, programs, etc. So in our training, we do include as many learning needs as possible. The training is, as I said, not just held when the tablets are first given to the students, but we also have refresher courses every year. And in most cases, we create training that follows the different infrastructures that are present in state schools and non-state schools, because as I'm sure you're aware, the infrastructure is not the same. But also the different needs identified. Now, in order to have an inclusive environment, we need to cater for many individual needs. So as much as possible, we invite educators to also approach us when they have specific needs that they need assistance with. It is very important, as we have emphasized throughout this conference, that we tailor-made for individual needs, rather than try to take an approach of a one-size-fits-all. So as much as possible, we invite educators, also other professionals working within the education environment, to approach us when they have issues that they would need guidance on, of course, when it comes to assistive technologies and their application within schools.
And who is feature matching the tablets to the children? Do you work with occupational therapists or physiotherapists that help with difficulties to access?
Within our ministry, of course, we have a number of professionals that work together whenever there are difficulties that are encountered within schools. In our case, we work as much as possible with the difficulties identified through the school system, through the educators, their head of schools, the head of college networks. And yes, if the need arises, we are open to working with any professionals for the benefit of our students. So yes, if there are difficulties that are being encountered, we welcome this collaboration. As I said, not just with tablets, but also with other devices. We had a specific program for the resource centers, for the training of the educators working there, and also for the students that attend the resource centers. But there are difficulties that are encountered also in other schools. So as much as possible, we try to cater for these needs with using the resources that we have within the ministry, and if need be, we are willing to work also with other ministries to reach this objective.
Thank you. I'm not sure if anyone in the audience wants to unmute themselves and ask any further questions. I can see a question just came in. Are parents being consultant on designing these programs?
Yes, I wasn't here when the 1 tablet per child was conceived, but as the time went by, and also now that we are designing the new project for year 7 upwards, the 1 device per child, parents are an important stakeholder. Parents are given training as well. And also when we have other initiatives, like my colleague Mauricio mentioned, the exam reader pen awareness conference that we held in May, it was very important for us to also have one-on-one time with parents. We opened our premises to parents. I was very pleasantly surprised with the turnout because we had a queue waiting. We also had international specialists here who could assist with issues for the reader pen when being used in a multicultural context. We have to understand, like many other member states, in Malta, we also have a number of foreign nationals that were using the pen, not only for inclusion purposes, but also for translation purposes. So it becomes a bit more complex than it was originally intended. And we had a number of parents, especially who want to support their children by learning how to use the pen themselves and using the different functions and trying to understand which functions are applicable for their child and which aren't. The pen gives you that flexibility to tailor make the experience for what you actually need. So yes, I think parents are extremely important when we are analyzing where we are and where we would like to go with projects that are widespread on a national scale.
Thank you. I can see that Patricia Mayer has her hand up, so you can Feel free to speak.
Basically, my son is in year 4, so this is going to be his first year for the official examinations. My question is, are there plans to make soft copies of the examinations more widespread? Is there a program for that? Because I'm finding quite a lot of locked doors.
So if I can actually attempt to address this question, the possibility of having examination papers in soft copy already exists. Obviously, when there are students who have professional reports indicating that there is a particular need. In fact, in schools, we are basically regulated as well by parameters set by the examination assessment unit, and the possibility of using assistive technology like text-to-speech, even during exams on a laptop, is a possibility. Obviously, a requirement that would need to be fulfilled is the need that the learner knows how to use the device. So, for example, I have a number of students who were actually following that during exams, okay, rather than having a human reader or making use of a reader pen, have a laptop, they have a soft copy of the examination paper, and through the immersive reader, the text of that paper is actually read out. So, I mean, as a directorate, we are all out to make sure that the needs of all students are actually catered for. So this particular need, obviously, can be actually addressed.
Thank you. I'll be contacting you further if you don't mind. So I don't take care.
Okay, thank you, everyone. We're going to have to close the question and answer section for a while. We're going to be taking a short 5-minute break because we are over time. The break is going to be a little bit shorter. Okay, thank you. We will be recapping at 11:25. So if anyone wants to go make a quick coffee, go ahead. Okay, hi everyone. It's time to continue with the conference. We're going to have a talk by Henriette Chibaras and Katia Cortis now on assistive technology and employment. Katia graduated in psychology and social studies, and after 3 years in the education sector, she dedicated 8 years to social and disability sector, and she currently holds the position of corporate client service managers at the Linus Spiteri Foundation. Henriette is an occupational therapist, and she has been working as principal executive and occupational therapist at Jobs Plus for the past 8 years now. She works with persons with disabilities and vulnerable persons to assess their work ability and the need for any assistive technology or reasonable accommodations at the workplace. So I can pass the floor to Katia now. Thank you.
Thank you for the introduction, and thank you Aġenzija Sapport as well for inviting us to present during this very interesting conference. So as Theodora mentioned, I come from the Linus Spiteri Foundation, and I thought of starting with a brief introduction about what we do and our services to give you more of an idea of what our work involves, and then move on to our input when it comes to assisting persons with disability, especially in relation to digital assistive technology. So as a foundation, I'm trying to change the slide. Somehow this doesn't, oh, okay, let's see. Very well. So as a foundation, we started off in 2015. Our foundation was initiated in 2015, following the government's enforcement of the 2% quota, which stipulates that 2% of persons with disabilities, 2% of a company's workforce have to be persons with disabilities. And the foundation was created to assist all individuals with a disability to find and sustain their employment, as well as to support entities and organizations in this regard, in their efforts to employ persons with disabilities. Our aim, obviously, is to support and bolster the inclusion of persons with disabilities within the labor market. To do so, we collaborate very closely with Jobs Plus, who are our partners, and who are also Malta's public employment agency. So let's start a bit with the process. I will not go into much detail because my colleague Henriette will be providing you with further details as to what is done when a person with a disability is interested in finding employment. So she will provide more details when it comes to the application process, as well of our use of the OT services in order to both assess as well as support persons with disability, both prior to them finding employment, as well as whilst they're within a working environment. So once a person is confirmed on our register, they start meeting the profiling and guidance executives. The profiling and guidance executives meet the individuals, and together with the individual, we create an action plan which will finally lead the individual towards employment. So we get to know the person registering, we get to know the person in front of us, and we evaluate and see what their interests are, what their abilities are, as well as what support they would require in order for them to be able to be fully independent and be able to gauge and be employed at the end of the day. At the same time, we also have the corporate relations executives whose scope is to support employers in the creation of vacancies. So we encourage enterprises and we collaborate with them in order to create vacancies which are specifically for our clients. So which are specifically carved. When we say job carving, we carve the roles, we amend and adapt the roles in order to ensure that they match our clients' requirements, whilst obviously keeping also in mind the company's requirements. As a side note, for those maybe who are not that familiar with with Malta's context, the government also provides subsidies for companies which allow them to make the necessary adaptations, as well as also include the possibility of making use of assistive technology within their work environment, to again ensure that persons with disabilities will be able to fully contribute at their place of work. Apart from that, we also provide the support of job coaches. So whenever an individual starts employment, we have job coaches from our end assisting the individual according to what they would require. The intention is for job coaching support to be gradually weaned off in order for the person to be fully integrated and independent at their workplace without our support. Having said that, there is no specific time frame for job coaching support, and we will continue to assist the individual according to their needs. We take a very person-centered approach, as you will also see further on when I will be mentioning our assistance in terms of digital assistive technology. So what do we do as a foundation when it comes to digital assistive technology? We act as intermediaries or brokers, if you may, to assist the individual either or both during the initial stages when we get to know the individual and we observe that the individual might require more support. So we refer clients to other organizations such as FITA, which is the Foundation for Information and Technology Accessibility, as well as Aġenzija Sapport itself, in order either for them to make use of their services. For example, FITA provides different courses which enable the individuals to learn how to make use of various digital assistive technologies, as well as other courses. And Aġenzija Sapport, which also provides certain subsidies as well when a person would require a specific digital assistive equipment. We also provide the necessary assistance whilst we are supporting the individual at the place of work. So through the utilization of job coaches, we also help the individual to make use of the available digital assistive equipment that they would require in order for them to perform well at their workplace. From our experience, we can confirm that providing both obviously this digital assistive technology and equipment, as well as the necessary assistance along the way to support the individual to make use of such available technologies. And we can confirm as well that this will therefore in the interim result in further independence and can also bolster the inclusion of persons with disabilities within their workplace. I thought of providing you with a few case scenarios for you to get a better understanding of our work in practice Obviously, the information provided, for example, the names, we've used pseudonyms in order to protect the personal data of our clients. And in this case, for example, we have Danica, who is an administrative assistant, and Danica uses JAWS, which is Job Access with Speech, and this supports her in making use of different websites for her work. So sometimes, for example, Danica would need the job coach's assistance when it comes to navigating new websites. So there would be a new website and the job coach will assist Danica to use JAWS in order for her to be able to navigate the website whenever there would be a different format, and support her until she gets used to going about and searching the necessary websites and so on. Danica also, for example, makes use of ORCAM, which is an assistive equipment which supports her in face recognition, differentiating colors and text. And once again, the job coach supported Danica in applying, in this case, for an EID, which she also required support in order for her to apply for the necessary schemes for her to be able to benefit from certain subsidies, which are also available through various organizations. Danica had 3 lessons set up by FITA, the organization I also mentioned earlier, to learn how to use the device. And our job coach was also present in order for them in the first place to learn about this assistive technology, and also then support Danica in making use of this technology. After each session, in fact, the job coach practiced with the client and assisted her whenever she ran into difficulties. Furthermore, when time permits, the job coach also practices typing with the client. We also provide one-to-one sessions where necessary, and we assist her in using a particular website in order for her to type and having the JAWS system read what she needs to type. So that by enabling her to practice in her free time and having these one-to-one sessions, then Danica once again will be able to perform better while she is at her place of work. Another case scenario of Mark, who is a technical assistant. In the beginning, the job coach mainly used to assist Mark in creating PowerPoints. Mark used to use a magnifying software to enlarge the text for better visuals, and also assist and also assistive hardware such as ballpoint mouse. And recently, Mark has been given an additional task, which for us is always a win, and it also shows that persons with disabilities at the workplace can continue to further develop within their career as well. The job coach assists Mark in this case and reminding him to make use of the screen reader to facilitate the understanding of what's written and to make use of the magnifying glass. And lastly, an enhanced letter keyboard, which makes differentiating letters much easier. These are obviously different case scenarios. Something important, which I do not think I have mentioned as yet, is that we take a very person-centered approach. So according to what the individual would require, we adapt our support in order to ensure that we're providing the required assistance for the individual to be able to work and perform better. Another case scenario, this was a bit of a different case scenario because we started supporting Carl, who is currently employed as a junior admin officer. We started supporting Carl for a different reason to what support was then provided. In the sense that in the initial, although we knew Carl beforehand, once Carl was employed, the job coach noticed that Carl was having difficulties with his vision and therefore he needed a few adaptations. So we made use of the available technology that we have such as the screen zooming, so that Carl would be able to see things more clearly. The job coach also assisted Carl in introducing the magnifying tool on Windows, which Carl uses whenever the zoom option isn't available. And the job coach also demonstrated to Carl how the cursor options could be altered. Furthermore, once again, Carl was supported to get in touch with Vita to explore further options and help him at the workplace. Should Carl require our support, the job coach can also assist Carl whilst he is undergoing any other courses that are available from other organizations in order to help him in this journey. A very important aspect, which you might have probably noticed during my presentation, is collaboration is key when it comes to supporting persons with disabilities, in this case, obviously, to make use of assistive technology. However, as a foundation, we strongly believe that collaborating with other entities is a must, I dare say, in order for us to make sure that the person is being supported at all fronts. Because we cannot see, someone else mentioned earlier, we need to take a systemic approach. We need to see the whole system and support the individual from all aspects. Rather, even though the organization's remit is employment, we need to collaborate with other entities to make sure that the individual is supported as a whole. That is what I had prepared for you for today. I will now give the floor to my colleague Henriette, who will be able to provide you with further details about her work as an occupational therapist when it comes to supporting persons with disability within employment. Thank you.
Hello, Kasia. Thank you for your presentation. So, let me share my screen. Coming. Okay, I found it. Matching. So, can you see the PowerPoint presentation? I think it's shared. Okay, so thank you. Okay, so thank you for this opportunity to share our role within Jobs Plus with regards to assistive technology and digital assistive technology. So, as already mentioned before, I'm Henriette Chiberras. I'm an occupational therapist. I graduated in 2009 at the University of Malta, and I completed my master's in vocational rehabilitation in 2014 at Sheffield Hallam University in England. Then I had the opportunity to work in local hospitals and also in a hospital in England for a few years. And in 2015, I started working as an occupational therapist at Jobs Plus. Just a small note before I start. So, as you can see in the PowerPoint, my work, my service at Jobs Plus may be co-funded by the EU under the ESF funds, while, as you know, this conference is being funded by the Erasmus Programme of the European Union, as you can see in the slide. Okay, so just an overview. So basically, I work within the Inclusive Employment Services Division of JobsPlus. This division assists persons with a disability. We even assist former substance abusers, former prison inmates, and even other people with socioeconomic difficulties. But just for you to know, but for the purpose of this presentation, I will speak about our services with persons with disabilities. So very briefly about the registration process, as my colleague Katia from the Assistive Foundation previously mentioned as well. So basically, to become a member of the, to become part of the register of persons with disability of JobsPlus, one would need to fill in the JobsPlus application form, which you can see it on the left-hand side of the presentation. Along with this is the first page would be the personal details of the client, and the second page, a doctor would need to fill it in, or a psychiatrist or a psychologist. So once it is filled in, the client sends it to us. Once we receive it, we send the client for an assessment from the doctor. After that, the client is assessed by an occupational therapist at JobsPlus, which is usually me. After the occupational therapist, then we refer the client to the Hospital Foundation. So then the profiling and guidance executive at the Hospital Foundation meets the client, and basically they make a profile of the client, and together we see what is the best pathway for the client, together with the client as well. The client is always the center of of our work. So the occupational therapy services at JobsPlus. So to speak, to come to describe more our role at JobsPlus. So as occupational therapists within vocational rehabilitation, which is the helping people to move into work or go back to work, our role is to promote health and wellness, prevent injury, maximize work performance and participation for clients who experience challenges in attaining, maintaining, or resuming work because of disease, disability, or injury. So basically, this means that for people who are looking for work, people who were working, they stopped working, or they lost their job because of a disability, and they wish to find another job. And even for people who were working, who are working, and they acquired a disease or a disability, and they wish to resume their work. So they are finding it difficult to do their jobs, and we can also help them to find ways of keeping their job. So also not just finding a different job, but also keeping their current job. In that area we also help the clients. It is very important to highlight that we take a holistic approach to the client. We consider characteristics of the client, work tasks, the environment, and the context. The environment refers to the physical, social, and the attitudinal environment in which people live and conduct their lives, which can have positive aspects or negative aspects on the client. So it can facilitate or hinder the client's function, while the context is different from the environment, because it's about the personal factors of the client and how these interact with the environment. So we also consider that in our work. Like, for example, we consider the client's age, the client's educational background, socioeconomic status. Consider the client's what he finds meaningful and purposeful in his life. His habits, his routines, these are all important when you are assessing workability and when you are helping the client to find his pathway towards work. So basically, the occupational therapy vocational assessment, we call it vocational assessment because it's an assessment related to the work skills. We assess the client's workability. During this assessment, we assess the client's physical, sensory, cognitive, communication, emotional skills, and performance in activities of daily living. I wrote which are related to work, but in reality, most of the activities of daily living go into work because, for example, if a person needs to use the bus to go to work, or if a person needs to prepare his lunch for work, or for example, the person needs to know how to dress appropriately for work. All these fall under activities of daily living, but they are really important skills to have to be successful at work. We also assess the need for any special equipment or requirements needed at the workplace. And the last one, you can't see it perhaps, it's assess the client's awareness of health and safety at the workplace. This is a very important aspect as well, because we want to ensure that the client is safe at work, and we need to consider the environment where the client will work to make sure that the client is aware of any possible hazards and how the client can avoid getting injured. We also provide recommendations on support needed at work. So Katja, in the presentation, previous presentation, she mentioned job coaching. Part of my role is also to recommend job coaching or mentoring, where during the assessment, if I see that the client will need job coaching at work, I will also take a note of it and refer to the Legal Hospital Foundation. And also, during the assessment, I also from the assessment, I get to know what employment training program would be best for the client, because some clients that we see may not be ready for work at that time, but they might need some employment training programs. So I also advise that in my assessments. And also, we also, together with the client, we also get to know some work tasks and possible jobs which are best for the client. I also do ergonomic assessments. Ergonomic assessments are workplace assessments which are aimed at minimizing injuries and improve performance at work. This is a very important step before thinking about digital assistive technology, because we need to make sure that the client is properly seated, that the workplace is accessible for the client, that the client is comfortably, the desk and the mouse and the keyboard are comfortably positioned for the client to avoid repetitive strain injuries. We also need to consider the cultural aspect of the environment, the attitudes of the client colleagues, because as mentioned before, the speakers before me mentioned how important it is that people around the client take on board that the client needs these devices, and they also need to have an idea of the device, what is its use, why does the client need it, and maybe even how a very small idea of how to use it, so the client finds any difficulties they can assist. So it is very important that in the ergonomic assessment we don't just assess the physical environment, but also these attitudinal and cultural factors, which will also affect the clients when using digital technology. In my work, I also use standardized assessments, like the assessment of work performance or the work environment impact scale. These assessments help me a lot to have a holistic overview of the client and the environment and context and the work tasks. So just a few examples of assistive equipment that I've used in my work. So as you can see, this the first one is a photo of a client who needed an enlarged keyboard and a trackball mouse. So basically, this client had limitations to move his shoulder and his elbows. So to move the mouse over the table, over the desk. So I gave him a trackball mouse, which is operated using his fingers. So when he uses his index finger over the trackball, the pointer will move. So he doesn't need to move his shoulder while mousing. There are various adapted mice which we use, and like in this photo you can see here, this is a vertical mouse. That we may also use that to avoid repetitive strain injuries when people have wrist or elbow repetitive strain injuries. So we also use key guards, which is the one at the bottom. It's a molded plastic overlay with holes that isolate each key. I used this for a client who had tremor, and he had problems with when he was typing, he was pressing more than one key because of his tremor. So this really helped him to isolate the keys and also type faster. I also have another example, the tabletop magnifier, which can be used. It's a simple assistive technology which can be used to enlarge text. We also use enlarged monitors, making for fonts larger for people who have visual impairments. I also wish to speak about the Microsoft accessibility features. Maybe some of you have heard about it. Microsoft, if you go on Google and type Microsoft accessibility features, you will go into a whole website full of accessibility features which are free to use. They are designed by Microsoft for persons with various disabilities, and they are free to use. And the guide is quite simple. You can see it is classified according to the disabilities: vision, hearing, neurodiversity, learning difficulties, mobility, and mental health. I will give you some examples briefly, like for example, the focus assist, which helps to avoid distracting notifications when you need to stay focused. So you will not have those pop-up emails coming when you want to really focus. You put the timing, you say from this time to this time, I won't have all those distractions. Use dictation to convert spoken words into text. Type without a physical keyboard by using the on-screen keyboard. And there's also an editor of spelling and grammar, the Microsoft Lens to capture notes and information from whiteboards, menus, signs, handwritten memos, so that you don't need to jot down notes or rely on blurry images. It can even be good for capturing sketches, drawings, and equations, and even images without text. And the Office Lens gets rid of shadows and odd angles so that images are easier to read. These are really good, for example, if you're in a meeting and they are showing something on the screen and you want to capture it, it's a good tool to use. And also present real-time with subtitles, which I am using now here. As you can see, these are real-time subtitles for persons with auditory impairment, something which I've used now so that I can show you how easy it is to use them. Something which we use a lot and it's good also for you to know, like easy reading can be made easier with friendlier fonts. For example, the Comic Sans font, the letter A is done in a like we write when we are writing in cursive, as opposed to the letter A, which is usually in other fonts. And this is really good for people who have intellectual impairment and they have limited ability to read. So if it is the letter A, it's written as in cursive, you know, it might make it easier for them to understand the word. And also the use of a chat to communicate with colleagues instead of telephone calls. I've used this for a number of clients at work. Some clients with autism or clients who have difficulties with communicating or don't really like to communicate verbally. This is a very good tool that they might use to communicate with other colleagues instead of telephone calls. As mentioned before by Katia, there's the Windows Eyes, which is a software application for the blind and visually impaired, which converts components of the Windows operating system into synthesized speech, allowing for complete and total access to Windows-based computer systems. And then the JAWS is a free reading software that allows the blind and visually impaired users to read the screen, either with a text-to-speech output or via refreshable braille output. We also make use of apps to improve independence. It's also part of digital assistive technology. So basically, we have bought the access to these apps. These apps incorporate video modeling, photo-based directions, talking stories, and even illustrations of behaviors. So our clients can make use of these apps. We can even project them on a wall so that we can make a group session. And we had our clients to learn how proper hygiene, dressing, health and safety when health and safety skills when we are with males and females, social success, greeting friends, appropriate social skills, problem-solving skills. There are lots. There's even the community access here with community success, which fosters practice with independence in the community. So this is also a tool which we use to help people with learning difficulties and with autism. It's very good because it's visual and it's concise and it's, even people, the young generation appreciate having something on a tablet, sometimes more than a book or papers. As my colleague Katia mentioned, we do a lot of collaboration because I cannot, as a professional at Jobs Plus, cover everything. So I have to liaise with other entities. I liaise a lot with the ACTU, with FITA, and we also refer a lot of our clients for training courses to enhance their skills. In fact, I believe a lot in training courses for persons with disabilities, and I believe that there should be more training courses adapted for persons with disabilities, because I think if persons with disabilities are more skilled, they will be more attractive for employers. So I think that is very important. I also believe that we should support employers to provide employment and training opportunities for persons with disabilities by promoting the Reasonable Accommodations Act, incentives provided by Jobs Plus, such as the access to employment, bridging the gap. And also, it's very important that from our work, when we have clients who make use of a device, it is important that professionals model the device and give a handover to other people. So if the client is now attending our program, the Sheltered Employment Training Program now, which we are training the client for work, it is important that if he has a device, there is a professional who can come here and show how the device is used to our job coaches, so that we can continue and help the client to use the device and not not just leave that at home and he's not using the device. It's important that there is a good handover by professionals to other people who work with the client, so that the client uses his device in all contexts. Okay, so that is the end of my slide. I'm sorry for taking a bit longer. Here's my email and contact number in case you need to contact me or ask further questions. Thank you.
Thank you very much, Katya and Henriette, for your presentations. I'm aware that we are running behind schedule, so let's move on to the next speaker, who's going to be Mr. Kevin Parascandalo, who is currently doing a master's in business and administration, and he will be presenting his project to us. We can see your slide, Kevin, but we can't hear you. I'm not sure if you're muted.
Hi, is it okay like this?
Yes, thank you.
Okay, so actually, as I was starting to say, this is my master's degree, but I had the results has been issued last week, so now I can say that I have a master's degree in it. And my research was about the use of accessible websites, especially in Malta, obviously. So the question came to my mind eventually in 1990 during a walk in the pandemic, where eventually I'm a father of a special needs girl, and the question was this: how these people are going to make both ends meet when lockdowns were on? So this was the first thing. At that time, I haven't even started my master's. So now to get you in a picture, this is an introduction. So how I'm going to go within the presentation. The meaning of our disability, because we have to understand the various types of disability, the standards of disability, which there is the W3C, the World Wide Web Consortium, and the European websites standards, which goes hand in hand. Then the research was the knowledge of the business community, and obviously the counter argument was the willing of accessing the online services by the people with disability within Malta. So we might think that disability is only that one which is visible. So here we have some ideas, but eventually we all know that we have various of unseen disabilities. Let me put you in another picture where I can tell you that this disability can happen at all times. Eventually, from my research, it happened to be that only 19% occurred from birth. From that onwards, it happened anytime. Especially we have over 20%, which happens 60 plus. So we might consider this as useful for everyone in today's technological area. So the Maltese law describes disability as a physical or mental impairment that substantially limits one or more of major life activities of a person. Moreover, the European Union and the United Nations describe disability as a long-term physical, mental, intellectual, or sensory impairment which interact, as you can see, barriers. I might say that once in a lifetime, we all go into a disability by an injury, minor injury, some illnesses. So we might consider that what we hear are really optimistic numbers.
So what is the W3C? The W3C are a group of people which to create a form of standardization for websites, for accessible websites. They go with 3 levels, A, AA, and AAA. The A level is the basic, which I highlighted some very brief of their aspects, which is the website should be fully accessible through keyboards, free from keyboard traps, which we mean like in Microsoft Office, we use controllers for save. This you should, when we say keyboard traps, only with one button. Videos containing captions and no alternative to text. Like if we're mentioning a box, you write a box, not you draw a box. Then they have the level AA, which is you have to obtain the A level, and then we go to AA level, which then here we come to the contrast, color contrast, text complement with explanation on the presented images, which is rather today we call it like subtitles in videos or movies. Navigation, which will be consistent. It's not when you if you have a start, it will be constantly in each page at the same page. Accurate level of form fields where we have accurate. We don't have hiccups in it. Screen reader where we can have a screen reader and logical presentation of headers, which this will reduce the confusion of things for those who will be in need of these things of plain sailing presentations. Then it will go to the AAA, which is this is highly recommended for the tourism industry, where the contrast will increase to 7:1. Sign language interpretation and visual and audio files. No timing for a task. So if you were going to perform a task, there will be no timer of 10 seconds. If that will be the task will be cancelled, then they have to start again from the beginning, and context sensitive help is available. So whatever they need, the help will be available. Here are some links that one might visit to access the full standard of the W3C and for the European standards of this matter. So in my research, I started the research where I tried to find literature, which is, let me tell you, this is literally very limited. European and North American standards literature are very short. Middle East are the best the best papers you can find, in my estimate. This is a survey which was held between 2004 and 2007, where 44% of where businesses come from North America, 44% came from Europe, and the others from different countries or regions. Here we've got that. Let me tell you this. It was around about 200 contributors, where more than 50% say that they didn't know that this accessible website doesn't know that they exist. Then we have some other physical, other relations where one showed no interest. Only one of the 200 showed that has no interest to do these things. So what the Maltese business community thinks about the disability community, the disabled community, and their access for their websites. So I've been into 10 businesses, which are an executive body, airline, travel agent, insurance company, so supermarket, business and hospitality, home decor, technology shop, a business which gives mobile and telephony and TV, and a newspaper. Eventually, the findings were this: 80% of the businesses reported that their clients love online shopping, and then 60% say also that people love the physical shopping experience, apart from other, and the price dealing. Price dealing is a must. It's been reported that this has been done. It's very common in the Mediterranean sphere, which are so like Italy, and it's been one of the business industries reported that. So of all 10, only three has an accessible website. An insurance company which has a AA level, supermarket which has AA level. Potentially they are trying to go to a AAA, the supermarket reported, but obviously it needs much more time. And the hospitality and hotels, which they have a hotel chain and restaurants and so on, they have a AAA level. So the educational body, the technological shop, and the mobile and entertainment said that it's not possible for them to have a fully accessible website. They need physical contracts. The educational body said that their website is very, very big, so they try to offer alternative services like the technological shops that one can order online, he can pick up, or she, and or otherwise we deliver, whatever it might be. The mobile, the entertainment said, listen, for us it's difficult to say we send our representative because most of our things has to be signed physically, which it is somehow understandable, but not fully, because today we have digital signatures. So these 4 businesses, they don't even know that this thing exists. So the travel agent, which doesn't know that it exists, an airline, which doesn't know this website exists, although they are almost 90% of their business comes from online. The home decor, which also doesn't know that this exists, but I must be fair here. When I was interviewing this business, they asked me to show them an accessible website because they doesn't know that this exists, and immediately, without hesitating, they told me how much it might cost. 10, 15K. So I might go for it. It's worth it to do it. That was the approach, which for me, it was very astonishing. And the newspaper, the local newspaper, they believe that by putting it online, they can deliver you free of charge. They have the accessibility. So that's, I believe there is lack of knowledge here, which we can see. So then here we have some issues that the businesses reported. 90% of the businesses all mentioned that they believe in inclusivity. 60% said that they have had requests to improve their websites, and others they order and delivery and so on and so forth, which I already previously mentioned about these websites. Now we are going to the business to the disability committee, dwelling on how they want or whatever they might think about the online services. So I started here. One of my questions, apart from what was already mentioned, the age of disability, was this: how many of them they had internet? 96%. Which, let me say this, the contributors were over 180, which I believe it was very poor. And I was expecting over 500 of 5,000 invitations sent. Reported that they have internet. and 4% of them doesn't make use of internet. Here, there's the frequency of use, where we have over 80% of the contributors said they use it daily. Or another circa 15%, they said they use it almost daily, and the other few percentages, like 2-3%, they don't know the frequency. These are the sectors that I have investigated, which I believe they are vital for the healthy day-to-day running life. This governmental services, we are health services, education services, online libraries, daily needs, online shopping where it comes like home decor, like these things. And which is becoming another trend, the ready meal, the fast foods and ready meals. When it comes to the governmental and public service websites, we are proud to say that we have 99% of our governmental services and websites which are available online. But sorry, I regret to say that due to Eurostat, we are at the 19th place with circa 22% of our only public governmental and public services websites which are accessible, which again, in view of the European Union law, which they should be in 100%. We are not the only country. The first had reached of 45 with 45%, which is Denmark, accessible websites. So there is much more work to do. When I visited, I asked about the health websites. 28% said that it is pretty much difficult, or they cannot access these websites. I believe that health is one of the prime sectors. Again, it is a right that you will have a proper way of health. Then I went to the educational sector. Here we improved a bit, where we came with 19% of the disability community cannot access these websites or have very difficulty to reach these websites. Again, I went to the online library. I believe that everyone deserves the right to stay at home, reading a book, which is quite normal today. 32% of the disability community said that they cannot access or find it very difficult to access these libraries, which are sometimes you pay a fee to access them. So when it comes to daily needs, again, another 26% of the disability community said that they cannot access or they cannot order their daily needs via websites because they cannot, they find it extremely difficult to handle it. When ordering fast food, 25% they are finding it again very difficult. So they cannot stay at home in cold winters enjoying a movie and ordering a pizza, a burger, whatever it is. So they have to try to go or send someone to buy this food. So it is becoming. This is. I went through these things which I thought they are the basic needs, although I have my limitations to my research. When it came here, I think the Maltese business has to think a bit about it. 48.5% prefers to visit this foreign websites for their goods. Here we can say that all foreign websites have their applications. Applications in Malta are not as famous as we think. They mainly are done for promotional environment only. So these websites, I believe Maltese people are preferring going from the site for a sites because of these things. Because to be when you have an application to be accessed by Android or by iOS, they have to be fully accessible. So that's a problem solved. To be accepted there, your applications need to be fully accessible. So what disability community are finding it difficult to access the website? Alternative to text, they don't have, there are some missing things which are like images or something they don't have. The CTRL free is the one key short for accessing commands. Text enlargement, where with people with low vision cannot access, cannot enlarge the text so they can read comfortably. No explanation video. There's no videos. Keyboard free access. Here I can understand much more better because my daughter needs a keyboard free access. It's useless to have a communication device which can access everything if the website is not designed as an access free. Timing free access, where some commands are timed, and if you reach that command in time, you have to restart again. No screen reader, no sign language, and no screen contrast. So these are the main features that people with disability here in Malta, they are finding it difficult, especially in Maltese websites. So as a conclusion, we have 40% of our local businesses that they don't even know that these accessible websites exist. And while other 30%, they believe they can offer a full accessible website. And then when it comes to disability community, 26% of these people are left out, are left behind. So we are not meeting equality. That's from my end. I would like to thank you for sharing, for this experience. Thanks a lot.
Thank you very much, Kevin, for sharing your research, and well done to all of our speakers. I'd like to open the floor to questions. Is there anyone in the audience who would like to ask a question to Katya, Kevin, or Henriette? Okay, it doesn't seem like we have any questions at the moment. Well done, that means you explained yourselves really well. We're going to be stopping for a short break now until 1:45, so until 12:45, where then we will be starting off with a panel discussion. Okay, thank you. Hi, everyone. Thank you for joining us once again. So as I said before, we're going to be starting with the panel discussion. I won't be moderating this part, but I'll be passing the floor to Dr. Alistair De Gaetano.
Thank you, Theodora. Thanks for moderating in a great way the conference so far. So good afternoon, everyone. I'm Alistair De Gaetano. So I represent the Directorate for Disability Issues in Malta within the Ministry of Inclusion, which is Malta's national focal point for implementing the UN Convention on the Rights of Persons with Disabilities. And together with my great guest today, we'll be tackling the issue of digital accessibility in Malta. What are we doing? So first of all, a short introduction also about my link to the topic. As I mentioned, the directorate, like within which I work, focuses on coordinating legislation and policy in Malta, particularly issues such as accessibility, which emerge from Objective 4 of the National Disability Strategy, and specific issues such as augmentative alternative communication in terms of the National Autism Strategy. But for a better overview, here I joined by, from left to right, Sharon Borch from Aġenzija Sapport, ACTU, Access to Communication and Technology Unit, Owen Zamit from FITA, Rhoda Garland from the Commission for the Rights of Persons with Disability, and Marcel Attard from the Communications Authority, together with Dr. Vicky Gauci from the Department of Disability Studies of the University of Malta. I would like to thank Aġenzija Sapport for organizing like this panel and organizing this conference, and also the Ronald McDonald House Charities for giving us the venue from which this conference is happening today. So first, like we are going to, okay, what are we doing? And I will ask the different panelists one by one to introduce themselves, who they are, and also very briefly at this point, what their entity does in respect of digital accessibility. So I'll start from you, Sharon.
Hello, everybody. As Alistair said, I am Sharon Borch, and I work at Aġenzija Sapport at the Access to Communication Technology Unit. I am an occupational therapist and an assistive technology practitioner. And we are doing a lot in terms of assistive technology, even within our service. So like even as an agency, there are different things that we are doing. So I start with our service, and basically our service is comprised of occupational therapists and speech and language therapists as well. We have also an IT technician on the team, and basically our role is to do assessments for persons with disability who present with complex physical disability and communication difficulties, or they might have accompanying as well intellectual disability, visual impairment, or hearing impairment. And the requests are various. So they could be the request in order to access play. So we work a lot with the children to help them find play options that can help them in their play and be able to play like other children. We support as well access to the curriculum and work a lot for children to able to access through technology. It could be reading, they have a difficulty with reading, or they have difficulty with writing, and we use technology to be able to help them express themselves through writing and also read content and participate in the education. And we also work with adults, and we have a lot of adults as well who are coming back to us, especially because the technology now has really improved, and now they are trying to see if they can benefit from it. We also help persons with accessing communication. Obviously, communication is a human right, and it goes across all areas of our participation in daily living. And so we have a lot of this kind of referrals where we are supporting persons, assessing them, and then finding the right AAC solution for them. In terms of AAC solutions, these ranges from even the use of sign language and up to using low-tech methods. So this could be like communication boards, communication books, and then also we look into high-tech systems as well. So basically we look at all the range, and we try to see which is the best for that person. As a service, we also have a research remit, and we work a lot with ICT department and engineering department at the University of Malta. And we have been supporting some research also to be try this technology that they are developing even with persons with disability, and also do some consultation. And obviously another remit with us is to try to make awareness, inform the public so that they are aware of the service, but they are also aware of the mainstream technology. Nowadays, the mainstream technology has really expanded, even because of the designers are utilizing universal design. And so we are seeing that technology mainstream is also meeting the needs of a lot of persons with disability. So I think it's really important to know this is around us and we can use it. And so this is part of our role. As an agency as well, we are currently working on a project. It's a EMP on artificial intelligence. At the moment, we are doing research, market research, in order to identify what are the technology that are locally international, powered by, with AI, that can support persons with disability to have independent living. We are moving towards this and really trying to support persons with disability to be able to continue to live in the community. And obviously we're looking at how AI can support persons with disability. And also we are trying to we were talking about websites. We are also working towards having our services on our website and having website accessible as well. Obviously, this is a process, and there's a lot of working that's going on, especially, for example, in the coming year, we'll be also having sign language interpretation on the website. So I think
it was very comprehensive, Sharon. We'll be coming to some other things afterwards, especially in terms of best practices and experiences learned. But for now, I would like to pass over to Owen from FITA, the Foundation for ICT Accessibility in Malta. I know there's a lot of complementary work that you are doing to what ACTU do. So if you could introduce yourself and the work of your agency, please, Owen.
Hello, I'm Owen Zara from FITA. At FITA, our work entails inclusivity and helping persons with disabilities and senior citizens achieving independency through ICT. At FITA, we have 4 different departments. The first one is outreach, where our employees go even in local councils, daycare centers, where they can teach our clients on how to access ICT. We have the training department, where they create content on how to use basic computer and mobiles to the level of basic SDL training as well, where clients can use them for even their hobbies, schools, and work as well. We have the research department, where they have ongoing research on what's available in the market, such as assistive technology. And the last department is that of the projects, where in this department we assess websites for accessibility, and we also produce Braille.
Okay, so thanks a lot, Owen, for that. We'll come into some other topics later. Before going on to Rhoda, I'd like to pass on to Marcel first, because I know that MCA, Malta Communications Authority, work very closely with FITA on a number of issues, and maybe you could also maybe explain a bit better MCA's remit and how you fit into the digital accessibility picture.
Yes, thank you, Alistair, and thank you for this opportunity. I come from the Malta Communications Authority. This authority was set up approximately 20 years ago as the local telecoms regulator. Over time, the remit of the MCA broadened and went beyond telecoms to include even digital services, e-commerce, and recently we are the appointed body to oversee the implementation of the Web Accessibility Directive. This is a European directive which came into force a few years ago, which basically focuses on making governmental websites and mobile apps more accessible. Basically, accessibility in governmental websites, it's not an option anymore now. Whereas before, maybe it was up to the discretion of the particular entity. Now there is a European standard, there are specific guidelines, and all the governmental websites need to comply. So this is a new scenario. It's an ongoing process, a continuous exercise, whereby we engage on assessing all the governmental websites currently in Malta. This is a very large-scale exercise because the same thing is being done all over the other member states. And what is particular about this directive, it takes a very proactive approach. I mean, we do not intervene only if there is a complaint, an issue on a particular website. We proactively embark in the assessment, in the continuous assessment of these websites. We issue reports, we send them to the entities, we guide them, we direct them where they have issues to fix. And I must say that it is a long process. We are still in the beginning, but the commitment is huge. I mean, it's a large commitment, both at European level, even in the local scene. A lot of financial investment has gone into this, and a large workforce is involved. As Alistair said, FITA assists us in this exercise, because at the heart of our assessment, of our testing, there are the people with disability that they themselves are assessing the website with the assistive technology, and they give us their first-hand feedback, their experience when using these websites.
So thanks a lot, Marcel. I should be coming back to you and Owen later also. Some more specifics about this process and also the involvement of disabled people in it. Before that, however, I'd like to go over to Rhoda Garland, like Commissioner of CRPD. So if you could explain like what CRPD does, what you do, and how you fit into like this picture. Thanks.
Okay, thank you, Alistair. So CRPD have a regulatory role within the disability sector, and our overriding principle is to monitor the implementation of the National Disability Strategy, which obviously covers all of the areas that we're discussing today. In addition to that, we work on policy and guidelines that are related to the National Disability Strategy, and we liaise with other ministries and other entities to try and improve accessibility and inclusion in all areas. Otherwise, within CRPD, we have an area that deals with investigations into discrimination. So people who feel they've been discriminated against on the grounds of disability can register a complaint with us, and we will monitor that and look into it. We also have a group of draftsmen who will go out and check that applications for buildings have been put in place properly, and they also monitor all of the new applications for new buildings. And then we have other teams such as the research team. We have a disability equality training team made up of disabled people that go out and help with improving awareness about issues related to the disability sector. And we obviously have a help desk where we take calls from clients and try and point them in the right direction where they have queries about how they should get assistance. We also work with MCA on the Web Accessibility Directive. We have a focus group of disabled people who look at the list of websites that the government own and put them in some sort of priority order so that the websites that are accessed most by disabled people are actually the ones that are checked first to be made more accessible.
Thanks a lot, Rhoda. And before going to more specific examples linked to digital accessibility, I'd like to ask Dr. Vicky Gauci, University of Malta, to introduce herself, and also how the Faculty of Social Wellbeing, and specifically the Department of Disability Studies, contribute to digital accessibility research and practice in Malta.
So, as you said, Alistair, the University of Malta is involved in today's topic, basically. First of all, university-wide, because it has the access to disability support units, where they give reasonable accommodations for students with disabilities. And of course, digital technologies are a very big part of that service. There's an occupational therapist as well who gives advice on the various issues that crop up. Then at departmental level and at faculty level, we are involved in research, both locally and internationally, teaching as well. There are study units on assistive technologies and universal design, and we are also involved in the supervision of undergraduate, postgraduate, and PhD projects that involve also the use of technologies for people with disabilities.
Thanks a lot, Vicky. So I will now delve a bit deeper and ask about specific examples or best practices. And I actually like to speak first about the Web Accessibility Directive Working Group, which was actually mentioned by 3 of our panelists. So there's MCA, FITA, and CRPD involved. So let's actually start from Marcel, if you could maybe give a bit of a more specific overview of how the process actually is rolled out. And then I'll pass to Owen and to Rhoda in this respect. So Marcel, please.
Yes, the Web Accessibility Directive specifies that every governmental website needs to have an accessibility statement and needs to comply with the WCAG 2.1 guidelines that were even mentioned in our previous presentation here, up to level AA. The process, as Rhoda mentioned, we have a focus group specifically for this directive. We consult with them. Basically, we rely on them to steer us in the right direction. We need their feedback to see if the work is being done is effective. They tell us which websites to prioritize. Apart from that, we also discuss any awareness initiatives that we could roll out. We participate in events together. So there's a whole process. The actual monitoring process, then, we are in continuous contact with the entities. I mean, when a website is going to be assessed, we first notify the entity so they know that their website is being assessed. We have 2 types of assessments. We have the simplified testing, which mainly is done through automated tools that is handled by us internally by the MCA. Then we have the in-depth assessments. A smaller number of websites each year are tested in depth by people with disabilities, and this is the activity that FITA carries out for us.
Thanks, Marcel. In fact, Owen, if you could maybe give a bit more detail about this process, especially about how disabled people are involved in this, so then I can also link to Rhoda afterwards. So Owen, please.
Our in-depth process involves persons with disabilities testing the website. We test the websites through screen readers. We use the VDA, JAWS, and also the voiceover. We test on different levels of usage of the screen readers. We have testers who use the screen readers daily and are experts in using them. And we also have testers who are beginners in using the screen readers. So we have different perspectives. The second part is testing on keyboard navigation to see that the website is accessible through navigating with the keyboard. We test also for color contrast. This is done with tools. And after these reports are done by the testers, we compile it into one report. And we also include the user rating and feedback by the testers. Apart from highlighting the issues, we also give suggestions to these entities about their websites on how they can make their websites more accessible.
Okay, thanks, Owen. So definitely, and this is a very good point, that the end users, whereas a sample group of end users are actually involved in the actual testing. It's great to see also that you have, let's say, people who are at different levels, different stages. So we can also like have a reflection of what happens out there with people actually using those websites. However, there's also obviously disabled people who are in the group itself, who are the ones like put forward by CRPD. So I mean, what is the role of these people in the working group, Rhoda? And like, how does CRPD contribute to the working group?
Okay, so the focus group that CRPD have is made up of people with a diverse range of impairments. So we have people who have visual impairments, people who are autistic, people who have hearing impairments. We have all sorts of people looking at it. And it's their job to make sure that, because there are so many websites that the government produce, that they are tackled in the right order, because some websites will be a lot more used by disabled people than other websites. And obviously, in order to be able to make sure that disabled people have access to the websites that are most important to them, it's very important that these people are able to give feedback on the list of websites that need to be fixed, and they all need to be fixed, and the order that they need to be done in.
Wonderful. Okay, thanks so much for that, Rhoda. So I'm aware also that there's like 2 other entities who are not involved in this process. We haven't forgotten about you. So I will go like to Vicky first. With the University of Malta, you mentioned like a number of things, such as like supervising thesis, ongoing research. If you could pick 1 or 2 best practices, which you would like to maybe put forward in this respect when it actually comes to digital accessibility, what would come to mind? I will ask this to you, and then I'll go to Sharon from Aġenzija Sapport. So you first, Vicky. Thank you.
The research in this area has been going on at University of Malta for a very, very long time from various faculties. There's the Faculty of Engineering, Faculty of ICT, Health Sciences, and the Faculty for Social Wellbeing, and others. The most recent development, I would say, is that we've been sort of feeling that research is fragmented. Everybody is working a little bit in their own territory without exactly knowing what we are all doing in the area. And we thought of creating an assistive technology research forum. A few weeks ago, it was set up, and we are inviting any researcher who is interested in this area to join, so that we can, first of all, explore how we can work better together. But also, we would like to invite NGOs, disability NGOs, to be part of this, because we believe that all research should be beneficial in the end for the people with disabilities who are using the devices or whatever research is being carried out. So I think that would be an example of a best practice. It's just in the beginning, but obviously there's need for more collaboration, so that obviously we can give the best service out there.
Thanks so much, Vicky. That sounds really exciting, actually. And the collaborative approaches always do help. It's something we'll be coming to later also. Just a little question for any academic or anyone watching us out there, who would like to ask for more information about this or maybe participate. I mean, how should they reach out and to whom should they reach out?
Yes, I think the best thing is to write an email to me, and then I would guide them on how to become part of this forum.
Okay, thanks, Vicky. Maybe Theodora, if you could also on the chat, share Dr. Gauci's contact details in this respect, that anyone interested could also be able to contact her after the conference. Thank you. And now I will pass back to Sharon. I know you have loads of best practices. I know that a lot is being done in ACTU, so of course stick to 1 or 2 examples maximum. Floor is yours. Thanks.
Okay. In terms, I think the best practices in terms of ACTU, I think it's that we offer client-centered approaches, and this is something that is really important, that we do what we do, even if we are offering a service, we do it with the person with disability. They are at the center of our service. We listen to them, and together we find solution in terms that will meet their needs. Another, I think in Malta as a service as well, I have to say that we are also have expertise within our team when it comes to supporting persons with autism, when it comes to augmentative alternative communication. We have a lot of connections with international services like us, and I think we are doing a lot supporting persons with autistic persons who require communication aids, because either they find it difficult to speak in public or they haven't developed speech for various reasons. We are actually supporting this and trying to train as well a lot in the especially in the education system. I'm trying to also do school approaches, whole school approaches, in order to train everybody. When we say train, we also mean sometimes even the cleaners. Everyone should know about this and how to communicate and support a person but an AAC user to use their AAC system. So I think that's in terms of one of the best practices. And then also I think the aspect of research, we try to do research within our team as well in order to look at our service to see where we need to also improve, and also collaborating with other, especially with university. I think that's really important because they can help us and we can help also the community.
Thanks so much, Sharon. You gave so many good points we can latch on to there. First of all, you mentioned also accessibility for autistic people. We'll see very soon, later in the session, there'll be something very specific about that. However, I liked the fact that you mentioned whole of school approach, because even Vicky before mentioned fragmentation, and this is something which we are coming to. So at the end of the day, working together can make a big difference. Definitely, I'm going to ask about that also. And yes, I mean, it's good to not differentiate. You mentioned, for example, let's say having also the cleaners involved as an example. I mean, at the end of the day, all of us, let's say, have to contribute to these efforts to ensure that there's accessibility. It is a very delicate machine, one cog missing, and the whole thing falls down. So thanks for that. And this actually leads me to the next, let's say, round of questions for the panel, because it is great to see involvement of disabled people. It's great to see best practices, but obviously nothing is plain sailing. So there are always challenges out there. And I wanted to ask you specifically, because the topic of the panel is what are we doing? So, I mean, what are the challenges out there? Linking to what you mentioned with fragmentation, for example, lack of consultation. So what is actually really frustrating you in this area? Maybe we could start from Marcel in this respect. Thank you.
Yes, from our end, when it comes to the implementation of the directive, I think the biggest challenge is making a website fully accessible, which I think is very difficult for a number of reasons. I mean, to begin with, the needs of people with the various disabilities have various needs, and some are quite challenging, actually. Having said that, however, some other basic accessibility issues are very easy to implement on websites, like if we speak of color contrast, like proper headings, proper tagging, alternative text. I mean, they are really basic, very easy to implement, and they improve drastically the accessibility and then the experience when navigating a website. And I also want to say that, I mean, having an accessible website is beneficial to everyone. I mean, it's not a matter of disability. I mean, a simple, structured website is very user-friendly. It is proven to attract more traffic and to be much more usable.
Okay, thanks a lot, Marcel. Definitely, like simple things can go a long way. But where are we getting stuck? Oh, and maybe also, let's say from your end, you could like focus a bit more on this and also what challenges like FITA finds in like working in this area and also collaborating with other entities.
If I can continue with what Marcel mentioned, we find a lot of issues which are which can be easily adjusted. Such as alternate text on images. This is simple. If you have let's say, a picture of a cat, you just do the alternate text that there is a cat in the picture. Other things are unlabeled buttons, where people who are using screen readers, if there's an unlabeled button, they can't go on and use that part, such as if it's a button in a form. Other issues are with keyboard navigation, where there is lack of focus visible, and even the URL that shows in the bottom left. If there's no visible focus, a user who is using keyboard navigation can't know their location on the website. Basically, those are the main issues that we face while assessing the websites.
But how could those like be addressed also? So you mentioned, okay, there's like a very simple steps that could actually be taken, for example, with alternative text. So how would you reach out, let's say, to other entities or to users, developers to be able to address this? And also, what is the role of other partners and like how are other partners contributing or not contributing to this?
From our side, as I mentioned before, in our report that we sent to the entities, not only we highlight the issues, but we give them suggestions on how they can be fixed. Then with the third parties, I mean, it comes from their side that they take care of the report that we send and implement the changes that we suggest.
Thanks. Ro, the challenges. I mean, I'm sure you've dealing with a lot of challenges in the Commission. It is the equality body after all. So what are the challenges like you see in this area specifically, and how do you deal with these, especially also with other like stakeholders?
I think one of the things that's been mentioned here is the provision of reports so that people can make their websites more accessible. And this is really important because those reports talk about the ways to code things and the ways to correct the website through its guts, rather than by putting quick fix plugins in. One of the issues that we've had at CRPD, which we've had to highlight, is that quite often people think that they're going to make a website accessible by putting a plugin in, and the plugin may have options like high contrast and font size and things like this on it. But if you press those buttons, it will actually remove an awful lot of material from the website. It removes pictures. It will remove links. It doesn't change the font size of links, and it may well assist some people with visual impairments in order to be able to access the website, but it actually stops from being able to access for people who have intellectual impairments or people who need to be able to use a screen reader because the links are removed and the pictures are removed along with the alternative text. And also for autistic people, the colors change and it can be very problematic. So I think that these reports that people get from FITA are really important because there are so many free quick fixes out there, but they're not really fixing anything.
Okay, thanks a lot, Rhoda. I mean, we've seen from ourselves, from Owen and from Rhoda, definitely, I mean, there's a lot of challenges out there. I'd also like to look a bit more at the solutions, but it's important to actually map things out because at the end of the day, if you're talking about accessibility, these are all like barriers to accessibility. And especially like it's very saddening to actually see that some things are avoidable, could be avoided, are not being avoided. So it's good to take stock of what there is, but also to look forward to see what we can do. In this respect, I know that like you may have a couple of thoughts on this, Sharon, so please go ahead.
Yeah, I think like the key here is I think the key challenge I think we're experiencing in different sectors is the implementation, and I think this comes as well with legislation. There is the legislation. And maybe like you see Disability Act, it talks about access to employment, access to education, provision of resources, and there are the services who are supporting, regulating, and then when it comes to the implementation, there is that we are really getting stuck, and this is what as a service feel a lot. It's all the time, even sometimes you produce a report and with all the recommendations, with all the details, and it's work for a period of time because you've worked, because obviously part of our implementation is training the people around that person, the person himself. So for some persons with disability who are at a stage that they can take it on board and then can move on, then they will teach other people. But for those persons with disability, especially having intellectual disability, who their process of learning is, it takes longer and they would still require the support of external people. And then when there is a change, for example, in schools, change from year to year, from school to school, then we'll end up like no one have ever heard that this person had an augmentative alternative communication, or this person was using laptop in order, or a text reader, like, and they are always contacting us, and or sometimes like it was working well and then there was a change, and now somehow the AAC is no longer being used, it's on the shelf, it's not, and these are constant difficulties that we encounter, which obviously puts a lot of pressure on the service then, because then you can't see new people because you are constantly tackling these people who require the support. So I think if we really, I think the message I'll send out there is like to not just to be aware of assistive technology, but everyone has the responsibility to support each other. And if we are working or actually talking with someone or working a colleague who a person with disability, they are using assistive technology, we should support this a lot.
Thanks a lot, Sharon. There's a lot to unpack there, definitely. We'll be coming back to solutions, but like I'd like to ask Vicky now, your thoughts about like what Sharon and also the other panelists just said, and also from your like side, like any challenges which you feel should be put out there in this day and age.
Yes, there are various points I'd like to add to what my colleagues here said. But one of the things is that all the stakeholders at this point need to learn how to understand each other's language as well. Because, for example, I've worked in projects with engineers, with people from ICT, and you realize that we have to work hard to understand each other's language, if you want, because I have the lived experience of disability, but the engineer doesn't have a clue what happens in a rehabilitation clinic, for example. So it's very important to get together and work together, but also to involve the disabled people themselves from design stage so that they can, throughout the whole process, be involved. You know, the motto of the disabled people's movement is exactly nothing about us without us. And therefore, nothing, no device, no policy, no legislation should be created without the consultation with the people who are involved. And then there are other challenges like expense, access. We cannot take it for granted that all disabled people have access to digital technologies and to the internet, for example, because they cost money. So also there's another issue about repair and maintenance of the systems and the devices. Much of the abandonment of assistive technology happens because of this. They tell you it's okay until you buy it, but then the suppliers don't know how to repair it, for example. And that is a huge problem.
In fact, even as a service, sorry, like we spend a lot of time even on repair, and actually now on, as I said, on the team, we have finally an IT technician which is doing a lot of this. And now, for example, now like you start seeing like 5 years since we've like 5 years now from on, we are seeing people coming back because their system is not longer working, because obviously we know that technology has a 5-year span, for example, and this is specifically for digital technology. So this has to be taken into consideration as well. So it's it's not just like give something. There is a whole process around it.
Definitely. So thank you, Vicky. Thank you, Sharon. So in this respect, I'll pick on 2 points that Vicky made. The first was understanding each other's language. The second was also the motto of the disability movement, nothing about us without us, which we alluded to earlier. So going forward, we spoke about challenges, but obviously we have to think of solutions. So how can we understand each other's language, and how can we work together to make sure that there's nothing about us without us? I'll actually start with Rhoda on this point.
I think that disability as a subject affects all areas of life and society when it comes to trying to make things accessible. You can't have any type of policy in any of the areas that the disability strategy or any legislation that's actually passed that won't necessarily particularly affect disabled people. And at that point, when the policies are being created, there needs to be the engagement of disabled people to make sure that the policies are enacted. And also, I think even after policies have been made accessible, there's a tendency for ministries and entities to sort of tick a box and say, we've done that now, and then forget about it. And I think that as policies evolve, that there's a need to keep going back. Also, there's the issue that ministries tend to work in silos. They have their own work, they have their own subjects, and the idea of including disability in everything, if you are working in, I don't know, farming and fisheries, may not be at the forefront of your mind, but these are all areas that disabled people have the right to be included in. And so I think that the need to keep reminding people about the continual need to be taking disabled people's comments and their feedback into consideration is very important. One of the things that we have done in relation to accessibility in electronic formats is produce a set of guidelines, which was created by a group of disabled people within CRPD. We covered a whole range of different impairments, and they put together a set of guidelines which will be published soon on our website, and they cover a number of areas, everything from audio-visual content to electronic files, multimedia content, easy to read documentation, websites, mobile applications, and they go into a lot of details. They talk about font size, and they talk about the lighting, and they talk about subtitles and sign language. It's a very comprehensive document, and I think that getting that out to ministries and to the organizations, including private organizations within Malta who actually produce these documents, because everybody at some point is producing documents, will be a really important thing in order to be able to ensure that the opinions and feedback that disabled people have given is actually taken into consideration.
Thanks, Rhoda. So, staying on the topic of solutions, you mentioned, like rightly so, that the opinions of disabled people should be taken into account by different stakeholders when implementing solutions. Obviously, things do go wrong, things can go wrong at times, so it's very important to actually like have redress in this respect. One very, let's say, not well-known aspect is when it comes to the Web Accessibility Directive, there is actually a redress mechanism in that respect. So I'd like to ask Marcel to maybe give us a bit more information about what this mechanism is and how it can be used and by whom.
Yes. Yes, indeed, Alistair. The directive also stipulates that anyone using a website, a governmental website, that cannot navigate the website because of accessibility issues can give feedback, and there is a whole redress mechanism that takes place. I mean, all websites are required to have an accessibility statement. The statement is like there's an implementing act on the sections that it needs to contain. An entity has to say what measures it is taking to improve accessibility. Any known flaws or things that cannot be fixed are to be listed in the statement. And another very important section is who and where to contact if you have issues navigating, accessible issues navigating this website. There is an email address, a telephone number. This is present in all the governmental websites. Apart from that, the MCA also has its own mechanism. We have a complaint form that they can use. We have our channels, our emails, our telephone numbers, and even there's another channel through the CRPD that take also these type of complaints on our behalf.
Thanks a lot for that, Marcel. That indeed is helpful. In fact, I also wanted to ask Rhoda about the other side of things, discrimination and accessibility. So there's MCA's like remedies and there's your remedies. So could you give us a bit more of an insight into those, please?
Okay, yes. So we receive queries and complaints about lack of accessibility to all sorts of different things. And we have a team of people who will investigate what is going on. This would be usually under the goods and services section of our remit, and they will reach out to the people concerned who are responsible for the website or for the documentation on the website maybe, and they will liaise with them to make sure that a solution is put in place. Where it gets very, very technical, we may pass them over to FITA or to MCA to get better advice. But once a complaint has been lodged with us, we will always investigate it until we have a reasonable solution for the people who have complained.
Thanks, Rhoda. So with specific email addresses or contact forms, so in that case, maybe even Theodora would maybe also like share these details like on the chat. So like where should they write, or let's say where can they access the form?
So you can send an email to investigations@crpd.org.mt.
Okay, perfect. Thanks. And Marcel, from your end with MCA?
Yes, I can give our email address. It's web.accessibility@mca.org.mt. On our website, there's also a complaint form, so they can access also from there and get more information.
Perfect. Thanks so much, Marcel. Thanks so much, Rhoda. So coming to the way forward and like possible solutions, I'd like to ask you for your thoughts, Owen.
Way forward is to have a better awareness on website accessibility, being if it's for the public entities and even the private sectors, because once you publish a website online, it's there, so everyone can access it. Not a part of the population can access it, and the other part they can't access your website. As I said, FITA, we do focus on suggesting how you can make your website accessible. if there is any entities or private entities who have questions on website accessibility, they can always contact us to get help as well.
Okay, thanks. And also mentioning contact, like any particular form of contact or email address that you'd like to share at this point?
At the moment, we have a problem with our website, and we don't have the email right there.
Okay.
But
Like-
they can even contact us on Facebook as well.
Perfect. So yes, so if you could look up FITA on Facebook, be a great like channel to be able to direct any concerns. Thank you, Owen. So I am aware also that we are actually nearing the end of this. So I would like to now turn to Vicky and Sharon. Also in respect of a way forward, a collaborative approach, and you are aware also that National Disability Strategy mentions an accessible information policy. So you mentioned before, Vicky, the issue of fragmentation, understanding each other's language and talking to each other. So how could we actually make sure that even through a document, in terms of reference, we could actually set the groundwork to be able to have everyone around the same table, speaking more or less the same language, to be able to work together in the same way that you're doing with your forum, actually. So how would you actually suggest that we actually tackle, let's say, this impasse?
Yes, I think the important thing is to, first of all, get to know who the people are, who the entities are that are involved, create a directory. There could be one entity that kind of is the reference point, and where there is this one point of contact for this particular sector. It could be CRPD, it could be whatever. The important thing is that everyone knows who is involved in this, and to be humble enough to reach out, I think, because we have knowledge and expertise, each one of us, each stakeholder, but also we cannot undermine the amount of knowledge that disabled people themselves have, because they've been using the systems and the devices and the technologies all their lives. And so they have a wealth of information that they can share with other experts, perhaps, the professionals. And therefore, we need everyone's knowledge here to be placed together in this one reference pot.
Thanks so much, Vicky. Actually, I really like the point you mentioned about humility. I think we can all agree that, okay, it's not just a Maltese thing, but it is very much a Maltese thing also. We love our little territorial, let's say, areas. And also, I mean, sometimes, we can be a bit too proud to either ask for help or speak to the other side. And we actually end up lots of duplication of efforts. And also don't listen to disabled people, which is a big issue. So going past this, Sharon, I'd also like your final thoughts in this respect. How can I actually break through the ceiling and make sure that we can actually have something more harmonized and more streamlined? I know you talk about this a lot.
So I feel that there's the need to also have map the services that are supporting assistive technology. Even from the previous presenters, you can see that there are different professionals who are supporting. And I think mapping this and having it out there as well, it will help persons with disability to know how the system is, where they need to go, and also create pathways to ensure we are not duplicating, we are supporting each other, etc. And I think another thing is about putting assistive technology. I know there is this push, but I think we need to push more to put assistive technology at a higher level, at policy, and also to maybe even looking at mainstreaming digital assistive technology through all the policies, so that we make sure we are addressing it for two aspects. One, because we know technology is being a big part of our life, and it's helping a lot of people as well to be able to be to participate in society. And I think this will have an economical impact as well, because if we have, maybe at times we see that assistive technology can look expensive because you buy, but we need also to look in the long term. How does assistive technology affect on on the economy as well, because if you have a person using assistive technology able to be employable, then they are returning back. So I think that is something as well that we need to look at.
Thanks so much, Sharon. So we like spoke about involving others, like listening to others, and like now is the time to actually do that. So we'd like to open the floor to our guests who have like joined us like online. You can ask questions either like by raising your hand and speaking up, or else by typing, and Theodora will actually like read out those questions. What we will do now is this: we're going to take an initial round. We're going to take 4 questions maximum from people who will speak up, and another 2 questions like that Theodora could read out so that the panelists could then answer them. And then after that, there will be a short comment also about a very specific form of digital accessibility for autistic people, the AIRA project, like where we'll have a presenter from the European Council of Autistic People, very short intervention, and then further questions. So let's start with the initial round of questions. Anyone who has any questions to any of the presenters, please speak up now. Thank you. Hey, Theodora, from your end, are there like any questions which have been typed out, which you maybe would like to share?
Yes. We have a question. Are there any plans to offer a postgraduate in assistive technology?
Okay. Are there any other questions before that? So I can actually
there is another question, yes, as well.
So
do you want me to read it out?
Yes, please.
Yes, okay. Is there a particular person that voluntary NGOs could contact directly? Certainly NGOs might need financial assistance to come in conformity with the directives. How can we best address these issues?
Okay, so we'll actually address those 2 questions. So the postgraduate course, like Vicky, would you like to answer? Thank you.
Yes, I think it's been our dream to do this for some years, and it might actually come out from the forum that has been formed just now, because I think, as has been said, this is something that needs to be done. It involves multiple disciplines. And if we are going to offer a postgrad in this aspect, it needs to be multidisciplinary. It cannot be just one faculty that offers it. So yes, it is in our plans.
Okay, thanks a lot, Vicky. Now, when it actually comes to civil society involvement, funding, I don't know whether you'd like to maybe contribute like something about that, Rhoda?
When it comes to the funding for these, I have been informed by FITA actually that NGOs will be offered discounted rates in order to be able to make their websites accessible. I don't know whether possibly the voluntary organisations and the Commissioner for Voluntary Organisations may well be able to assist with that. I can find out and pass the information on.
Well, that would be great. Thank you, Rhoda. Owen, since Rhoda mentioned FITA, is there anything that FITA is like offering in this respect right now, or that it is planning?
Regarding NGOs, as Rhoda said, we know that some NGOs have limited funds, and we want that their websites are accessible. So when they come forward to us, we can offer discounts on the price.
Okay, thanks so much, Owen. So should you be interested, Owen mentioned before, there's like FITA's like Facebook page, I believe it's FITA Malta, correct? FITA Malta, so FITA Malta. And you can actually like reach out to FITA and also, let's say, ask further. And now I see there's other questions coming in. Before that, I know we are joined by Heta Pukki, who's the president of UCAP, European Council of Autistic People, and there's a very specific initiative and also a survey running right now as regards the AIRA project. So Heta, if you would like to take the floor, also I know you would like to share your screen in this respect and give a short overview of AIRA and the survey that's going on. Thank you.
Thank you. Screen sharing is disabled.
Theodora, could you actually enable screen sharing, please, for Heta? Thank you.
You can request us. Okay, we're doing it right now.
Thank you.
Okay, you should be able to share your screen now.
Yeah. And this here in itself is a little demonstration in accessibility issues. As an autistic and vision impaired person, I'm slightly panicked when I need to share a PowerPoint. So there would be certainly room for some development there.
Is there?
If you
Floor
can
is yours, Heda. Thank you.
Now I hope that you can see my slide in full screen view.
We can from here, yes.
Yes. So telling you today very briefly about the IRA project and survey. I'm representing is the European Council of Autistic People, or UCAP, which is an umbrella organization founded in 2019 and now connecting 25 European organizations run by autistic people specifically. We are in the majority in our own organizations. And the project we're running is Artificial Intelligence and the Rights of Autistic People. This is a 2-year project run by us and funded by the European Artificial Intelligence and Society Fund. What we've done in this project, we have so far conducted a literature review to look at the uses of AI concerning autism. And our little team found over 1,000 research articles, and they found that this was increasing exponentially. It seems to us that we are among the groups most heavily targeted in research involving AI. And themes that are very prominent are diagnosis, interventions, biomedical approaches. And what we find very much is that our voice is missing. There's not much participatory approach here at all. We've done consultations, talking to various researchers, human rights organizations, the European Disability Forum, the AI experts and developers and users of AI applications to identify any other potential areas of concern, as well as potential benefit. At this point, I would like to check, do you guys see my slides changing?
Yes, we do.
Yeah, okay, good. Yeah. So it is clear that we share many concerns with other minorities and disability groups when it comes to AI, including, of course, accessibility as a high priority, the need to develop AI applications so that they are they're built to be accessible from the beginning. With our survey, we now are gathering information about the knowledge and needs of autistic people concerning AI. We are going to develop advocacy training and materials based on this information. And our ultimate goal is to use the results of this survey to improve the understanding and application of AI, including accessibility as a major theme, through our engagement with NGOs, legislators, industry representatives, and others, which we already started in the process of doing these consultations. And over next year, we intend to publish our policy recommendations. Our survey includes some validated parts and some that we have designed ourselves. And we do focus somewhat on the diagnosis, biomedicine, and intervention parts, because those are very crucial, and important questions to our target groups, but we also include other elements. We have an international team, and we work in cooperation with the Belgian University and with a project in Finland. So far, we have 86 responses, and in order to get a comprehensive view, of course, we would like to have more. Our next steps will be data analysis, advocacy training, which we're just preparing to do in a couple of weeks in Prague, and the initiation of the development of those materials. And our team is going to publish a peer-reviewed article. The IRA survey currently is open until the end of this year, and we would like to request the help of anyone with any interest in this topic. Please help us to reach autistic people in your countries. take a look at this website, and please let any organizations of parents, service providers of autistic people know that we are seeking more responses. And so this is available in 6 languages. And please feel free to contact us if you have any questions about this. Thank you very much.
Thanks a lot for that, Heta. If you'd like to share the PowerPoint presentation like through the chat or like the survey link, please do that. Thanks. So Theodora, I'll switch back to you. I know there was like a further questions to them coming in. So if you would like to read out those questions, or like if anyone else would like to ask any questions, we can take a final round for the panelists to then answer. Thank you.
There are no questions currently in the chat. There are some interesting comments that people are sharing with
Yes, of course, you can share those.
What the panel is saying. And someone wrote that there's consideration is an important element being covered in the market research being conducted on AI technology by Sapport, and they want to ensure that whatever is invested in can be supported and maintained at a local level without making investments redundant shortly after purchasing for both the person with disability and the professionals assessing them. Someone has mentioned that they have given ideas with who we might want to collaborate with regarding the graduate topics, so I can pass that on to Vicky later. I can see that Kevin Parascandolo has raised his hand if he'd like to ask the question.
Yes, let's take the question, Mr. Parascandolo. Thank you, Theodora. So, Mr. Parascandolo, please go ahead.
Yes, has everyone thought to launch a promotional campaign about these accessible websites? Because
we can't hear anything.
Education is the mother of all thoughts. Thank you.
We can't hear you, Kevin.
Sorry, I was asking the panel if anyone has ever thought to launch an educational campaign about these accessible websites and their beneficiaries and everything. How it's gonna work?
Okay, so like if I understand correctly, like whether like any of the entities on the panel have had like educational campaigns about accessibility of websites, correct?
Yes.
Okay, so I guess I'll start from MCA and FITA, then go to CRPD.
Yes, in fact, very important point that I wish to raise also. One very important way to address these problems are by awareness campaigns. So we engage in these types of campaigns regularly. More than that, there is a lack of expertise in this sector. There are lack of materials, training programs, content, online content. So, I mean, we're still in the beginning, but we have just created some content with in collaboration with the University of Malta, the Faculty of ICT, and we will soon be rolling out a series of boot camps for IT professionals in the governmental sector, because, I mean, it may be possible to procure a fairly or largely accessible website, but it very easily goes astray once new content is being uploaded, different people are managing the website. So, I mean, accessibility becomes, it's like a moving target sometimes, and it's very difficult to maintain. So we have this program, which will be ongoing, because even people get out of jobs, new people, I mean, get in the job. So we will be offering this training, which is just the beginning, and we will strengthen our relationship even with the University of Malta to try and create more content and roll out more training programs in this sense.
Thanks so much, Marcelo, also for that like very like concrete like example of an initiative that you are giving. So Owen and Rhoda would like to add something, please.
Yes, earlier this year, our CEO even visited the university to talk about website accessibility. Apart from that, these last 6 to 5 months, we have been inviting secondary schools to come visit us at our offices, and we give them info sessions about our process on auditing websites as well. And we are also exploring further opportunities to raise awareness about website accessibility.
Thanks. So something finally from Rhoda before then I start wrapping up.
So last year, CRPD did a webinar that covered this area. It covered all areas of accessibility in websites and also assistive technology. And also with our set of guidelines that we're about to launch, our disability equality training team, who were the team that put the guidelines together, have been and will be talking about the need for web accessibility in all of the disability equality training sessions that they do. And if you would like to ask for those sorts of sessions, then we can be contacted on helpdesk@crpd.org.mt.
Thanks a lot, Rhoda. So, by way of wrapping up, first of all, I would like to thank Aġenzija Sapport once again for this initiative, for organizing the conference, and also like to thank all of the panelists and entities represented here. I would like to remind you that, first of all, like this event is also supported by Ronald McDonald House Charities. So a big thank you to them also, even for the venue. And that this conference is part of the wider Accessible EU scheme, which is piloted by the European Commission. Do check out their website. Also, there are events online and in person going on around the year for the next years, both in Malta and in other countries, dealing with all aspects of accessibility. So now I will pass to the different panelists for a final word, final thoughts as regards the topic we discussed today, and I will start from Sharon.
So I think the final thing is this. I think we need to collaborate more. And I think because it's, as I always say, this is not a one-man show, but requires different disciplines. I think together we can help in this sector and make actually persons with disability be able to have the opportunity to access different sectors like everybody else.
Okay, that's great. Thank you, Owen.
As I said before, I think we can focus more as well on awareness to be as inclusive as possible.
Yes. Okay, thank you. Rhoda?
Yes, I think a lot has already been said. I think that it's important that in all of this work that we are hearing the voices of disabled people so that their views and their opinions are included while we are collaborating with the different entities that are involved in bringing about these accessible websites.
Definitely, thanks. Marcel?
Yes, as I said before, this is just the beginning. I mean, we have just finished the first cycle of the monitoring that we conduct. We heard a lot today about assistive technologies. I think that an accessible website is in itself a type of assistive technology. It is also bringing accessibility, making it more mainstream. So I think it is the way to go. We are seeing improvements. Obviously, we're not in the place we wish to be yet, but I believe we're going in the right direction.
Definitely, a step on the way. Thanks a lot also for your work, Marcel. Last but not least, Vicky.
Yes, there's not much to add, but just to remind that when systems, websites, devices, technologies, anything is made in an inclusive manner, it benefits the whole of society, as Marcel said earlier. You know, it's not just about disabled people.
This is a beautiful thought, Vicky, comes from Universal Design. Thanks so much. So a big thank you to Vicky, University of Malta, Marcel, Malta Communications Authority, Rhoda, Commission for the Rights of Persons with Disability, Owen, Fita, and Sharon, last but not least, Aġenzija Sapport ACTU. Big thank you to all of you for being with us all day, following us, joining us, from different countries, different entities here in Malta and abroad. Thank you. We wrap up here. Have a great rest of the day, and looking forward to the next steps in this area. Thank you.
Thank you, everyone, so much. If you could please fill in our evaluation form that has been sent in the chat, it would be great. Thank you.